Good morning, everybody. Good morning to the Working Group 2 of the Global Coalition on Addressing Synthetic Drug Threats. Thank you for coming. Welcome to Rome. I'm very emotional today to meet all of you. We worked a lot during this month. We worked a lot to organize this meeting, and we are very grateful, and we thank our president of the Institute, Professor Rocco Bellantone, to host us in this building, in this famous building. So please, I ask Professor Rocco Bellantone to welcome all of us. Thank you, Professor.
Good morning, and welcome to National Institute of Health. It's my great pleasure to extend a cordial welcome to Honorable Jack Markell, United States Ambassador to Italy and San Marino, to Brian Morales, Chief of Counter-Narcotics Branch of the Bureau of International Narcotics and Law Enforcement Affairs of the United States Department of State, to Prefect Ugo Taucher, Advisor to Undersecretary Alfredo Mantovano at the Italian Presidency of the Minister Council. And furthermore, I would like to welcome all of the international delegates of Working Group 2 of the Global Coalition on Addressing Synthetic Drug Threats. It is an immense pleasure to host the first planning meeting in the present year at the National Institute of Health. The birth of the Institute was in the context of the fight against malaria, one of the great scourges of the beginning of the 20th century. It was thanks to this link between the Italian and American government that at the end of the 1920s it was possible to plan and then implement the foundation of the Institute with the financial aid of the American Rockefeller Foundation. Inaugurated on April 21, 1934, the National Institute of Health is the main Italian research, control, and technical scientific center devoted to public health. The Institute works to provide the necessary scientific evidence to propose more consistent health policy, together with the Ministry of Health, the regional government, and the National Health Service. Among the numerous fields of the public health research, the Italian National Institute of Health is deeply engaged in the prevention and control of addiction and drug-related issues, contributing to the knowledge of the phenomena from an epidemiological point of view, to the optimization of diagnostic therapeutic pathways and the improvement of social educational intervention through specific sectors of research, control, supervision, information, training, and advice. Moreover, the Institute has been actively involved in the national early warning system on new psychoactive substances since 2009, under the direction of the Department of Anti-Drug Policy of the Italian Presidency of the Council of Ministers. To this concern, we are honored to be winner of this relevant planning meeting, hosting such a distinguished group of scientists, scholars, and speakers to share their valuable knowledge to suggest solutions to address the global issue of synthetic drug threats. I wish to the delegates of the Global Coalition Working Group 2 devoted to detecting emerging drug threats and use patterns to achieve the goal of improving data collection, increasing information sharing, and better integrating research to improve the ability to respond to emerging drug trends. Thank you very much.
Thank you very much, Mr. President. I have to mention to you and to everybody here that even if we are not so many, but we are coming from different parts of the world, all over the world, Western, Eastern. So it's the first time the East world and the Western world can meet in this room. So thank you very much. Just a logistic question for the interpreters. For the English mother tongue speakers, please speak slowly so that the Russian and the Spanish interpreter can translate in time your speech. So now I have the pleasure to call on the floor the Honorable Jack Merkel, the Ambassador of United States in Italy and San Marino. Please, Ambassador, take the floor.
Thank you. Buongiorno, good morning, and thank you so much for the opportunity to be here. You know, I have seen firsthand the extraordinary damage that synthetic drugs can do to individuals, to communities, to families. I saw when I was the governor of Delaware, when I dealt with so many of our citizens who experienced this tragedy in their own families. And I've seen it as a friend to so many of these families. And I got to work with so many families, and I was always so impressed by how individuals who had suffered such deep and severe loss would end up turning their own personal loss into the benefit of others by working so hard to make sure that the tragedies their own family suffered would not be what other families would have to go through. And so I am so appreciative of the work that is being done in this room and being done around the world in so many countries. The work that you are doing to address synthetic drug threats. I think in many ways, the work that is going on in this room during this conference is just extraordinarily important. We live in a time when there's so much division and so much peril, and the idea that people would come together from countries around the world to work together. This may not always be on the front page of the newspaper, but it's on the front page of so many families. And so I thank you for that. And I know many of you have come a long way to be here. I do want to thank the Italian government for co-chairing this working group on detecting emerging threats and use patterns. And in particular, Dr. Pecchini, thank you so much. And I think you deserve so much praise for your leadership of this effort. And I do want to thank ISS and its president, Bellantone, for hosting us this week. It's also an honor, Mr. Talser, to be with you. And I would ask that you convey our appreciation to Undersecretary Mantovano for his leadership and support as well. Some of you may know that the land where we are today was actually initially contributed by the American Rockefeller Foundation. And this was following World War I. And in fact, one of my predecessors, the guy who was then serving as the U.S. ambassador to Italy, his name was Breckinridge Long, helped inaugurate this headquarters in 1934. And so I think it is very fitting that we continue the work that started then. I want to give particular credit to Secretary Blinken, the Secretary of State, who, as you all know, has so many profoundly difficult issues to deal with around the world right now on behalf of the United States. And even with all of that, with those difficult issues, he has put a real focus on the danger that synthetic drugs pose to so many families around the world and certainly in the United States. And he has said that the threats posed by these illicitly manufactured synthetic drugs, such as fentanyl, tramadol, methamphetamine, Captagon, MDMA, and ketamine, they know no borders. And so this is a problem that cannot be solved by one country alone. They threaten the health and the security and the well-being of people around the world. And so what could be more important than people from around the world coming together right here in Rome to work on this issue? Italy and the EU have been particularly close and effective partners of the United States in helping to manage this threat. And we are very appreciative that during Italy's G7 presidency, this issue is going to be featured prominently during the Home Affairs Ministerial in October. We can only manage this issue if we have everybody on board. And when I speak to a lot of young people these days about their potential interest in going and becoming diplomats, I think it's pretty easy to explain that there are very few issues these days that are contained within the borders of any one country. So many of the things that we focus on are the responsibility of us working together, and this is a very high example. And that's why the U.S. launched the Global Coalition to Address Synthetic Drug Threats. It's a forum for partners to collaborate on a whole host of issues surrounding this. And so with that context in mind, I want to stress the importance of sharing information and developing a common framework for data collection and analysis. I want to thank the co-chairs for their dedication, chairing monthly meetings of this group. And I would conclude by saying, and I know that there's a lot of data sharing that's part of this particular effort, but I would just ask that we always remember that behind every piece of data, behind every statistic, is a real family who is dealing with some kind of incredible tragedy. And the strength of this group is we can prevent, if we work together effectively, more families from having to suffer the trauma that too many have already suffered. So I think that is the spirit in which we are all gathered here today. I want to thank the organizers, and I certainly want to thank all of you for coming from many, many places around the world to address this together. Thank you all so much.
So now it's your time, Dr. Brian Morales, my American counterpart, the Chief of Counter-Narcotics Branch, Bureau of International Narcotics and Law Enforcement Affairs in U.S. Department of State. Welcome to Rome, Brian.
Good morning, colleagues. Well, I must begin by thanking our hosts, Italy, the Italian government. Italy has been a tremendously important partner in the area of counter-narcotics historically. I don't know if you all know, but the United Nations Office on Drugs and Crime has had 7 executive directors, 3 of those of Italian origin, showing really the leadership that Italy has taken on this issue. Many of the senior leaders today that are working at UNODC, including our colleague Angela May, my good friend Gilberto Gera, Giovanna Campello, and so many others are also of Italian origin. But I also want to highlight that civil society organizations from Italy play also a very prominent role internationally in addressing substance use. And 3 in particular, San Patrignano, Villa Maraini, which is based here in Rome, Asociación Casa Rosetta, which is based in Sicily as well. They work and they partner with us in Africa, in Latin America, in the Caribbean. So tremendous, tremendous support. And I'll say, of course, also thanks to the Italian government, which has been a champion and an ally in promoting evidence-based practices based on international standards in support of the conventions and the drug control system as well. Of course, thanks to my colleague Simone Picchini for all of the wonderful work in establishing and working toward this over several months with your staff as well as the Colombo plant and my colleague Sarah Finmore as well. I believe that our modest meeting here of 20 or so global experts comes at a very crucial time. The challenges of synthetic drugs are becoming more and more complex each day. Not just because overdose deaths are high, but also the fact that synthetic drugs are expanding to more and more countries. and also that the composition of these drugs are quite difficult to analyze, and insufficient research has been conducted on the interactions between the compounds and their impacts, even within one single drug sample. Globally, we have an important shortfall in our understanding because of the complexity of the problem and the lack of resources by many governments. Now, at the same time, we have also a lot going for us. We have a comprehensive understanding of the science of addiction and the brain. Treatment is possible. It's a chronic relapsing disease, and treatment is as effective as other chronic relapsing diseases like diabetes and heart disease. So we can take comfort in the research, 70 years of empirical research in the field. We have data collection platforms, tools, resources, actually many of them. It's not that we have a shortfall. We have a lot, and we have to figure out how to work and coordinate these different platforms together. In some regions, we're missing, and we have a lot to build in certain regions, but we do have in many others quite advanced and developed. So avoiding duplication, finding synergies, that's where a global group like this really it can be very beneficial in looking at that. We also have incredible commitments that we've seen through the Global Coalition on Synthetic Drugs. Participants who assembled through a ministerial, who have been dedicated monthly meeting after monthly meeting, and I want to thank all of you for your role in that. And especially I want to highlight that we are so fortunate to have the 12 co-chairs of working groups and sub-working groups too here on data with us. And of course, also our colleagues from the European Monitoring Center on Drugs and Drug Addiction with the experience and expertise that is sort of world recognized, and we're very grateful for their collaboration and partnership over the years. I think what's amazing is that this group bridges what we call the three legs of the stool when it comes to looking at this issue, which is research, policy, and practice. And just looking at the participant list, we see also a diversity from public health and epidemiology all the way through law enforcement and corrections. We're bridging the full spectrum that helps us look at this in a continuum of care. So I very much look forward to the discussions of this week to help us better understand how these different data systems can better connect to offer a clear picture of the drug situation and help advance the work of the coalition to the next step as we look at the implementation phase coming up in April. So thank you all so much.
So now it's the time of Dr. Ugo Taucher, the prefect and the advisor of the Undersecretary Alfredo Mantovano at the the Presidency of Minister Council. Alfredo Mantovano is in charge of the problem of drug addictions in Italy and represents Italy internationally. So you have the floor, Dr. Taucher. Thank you.
Mr. President, Mr. Ambassador, participant, it's a pleasure to be here today in this technical meeting in front of such a wide audience composed by professionals from all over the world. I bring the regards of the Undersecretary of the Presidency of the Council of Ministers, Alfredo Mantovano, the Italian political authority with the mandate for drug addiction policies in Italy. We would like to use this occasion to express our appreciation and support for the Global Coalition against synthetic drugs and for its ambitious and commendable purpose of creating a global synergy in order to tackle this growing challenge. Indeed, the phenomenon of synthetic drugs represents a transnational threat, since the criminal organizations that profit from this dangerous and harmful trade know too well how to go through borders and drug routes cross entire continents. Therefore, even if the phenomenon may currently have a different impact on the public health in the different states, we come from, it's crucial not to underestimate the potential harm that the spread of synthetic drugs may cause. Also, we must keep in consideration how this phenomenon may impact youth, that also through the web and digital platform may have an easy access to extremely dangerous synthetic drugs and new psychoactive substances that may put their life at risk or cause them long-term harm. Indeed, this is why, as Italy, we are currently drafting a national action plan against fentanyl and synthetic drugs, not only fentanyl, involving the relevant national stakeholders. We must stay vigilant and strengthen those mechanisms that allow us to respond to this challenge. We are glad of the results that we obtained through the early warning system, a tool that allows a prompt communication of the new threats at national and transnational level. In Italy, the National Early Warning System of the Department for Anti-Drug Policies, entrusted through a project to the National Health Institute and incorporated in the European Warning System, allows us to be in contact in real time with the EMCDDA and the other European Union states. I hope these 3 days will represent a fruitful occasion for confrontation and will offer valuable ideas to all the participants. Indeed, we must remember that global threats can only be addressed through global coordinated efforts. Thank you, and good work for these 3 days.
So now, before the ambassador and our president maybe have to go away, Brian and I would like to have a picture all together to remember this morning. So I invite you to go outside here in the other room. This room is entitled to a director, a former director, Pocchiari, Francesco Pocchiari, who was here I think in 84. And he gave really his life for the success of the Institute. Likewise, all the presidents we have here. So this room is entitled to him, and please go outside to take a picture and to have a coffee. Thank you very much to my president and to the honorable ambassador.
Well, hello, everybody. Good morning, colleagues. Good morning, evening, afternoon to those that are online tuning in. Brian Morales, the branch chief of counter-narcotics from INL at the U.S. Department of State. It's a pleasure to be here with all of you for this meeting. I have some slides to update everybody on the Global Coalition. For those that are co-chairs and international organization partners, this will be very repetitive and redundant of things that you know, but I want to make sure that we're all on the same page, also because this is being recorded and we are intending to post this on our website. We want this to become informative for others that are tuning in for the first time to learn about the Global Coalition's work. So I will just provide a background on how far the coalition has come and what is on the horizon, and then sort of conclude with what are the objectives of what we're doing for this meeting over the next few days. As you will know, the coalition was established in July of last year through a ministerial meeting that brought together nearly 100 countries and international organizations. At the ministerial level, we had lots of discussions, and then there was a UN General Assembly side event that also took place, also hosted by Secretary of State Antony Blinken. And what came out of that, following that, was the establishment of the 3 working groups that you see on the screen there. One on manufacturing and trafficking, one on public health, And then this one, which is related to detecting emerging drug threats and use patterns or data, to put it in a very simplistic way. I'm trying, there we go. So we then decided after September, when we established the working groups, that we had to delve into sub-working groups. And working groups alone were not sufficient to be able to give us the intensity of discussion necessary to arrive at concrete action. We created the working groups and the sub-working groups because we wanted, at the end of the day, to have some practical applications and initiatives and not leave it solely at the sort of higher level, policy level, but actually get into concrete action in advance of that. So we then established two sub-working groups, one on data collection, analysis, and trends, that includes early warning, and a second sub-working group that is focused on information sharing, interagency collaboration, and policy formulation as well. And we also established then the structure of co-chairs, two co-chairs for each working group and sub-working group that we have, so that we could have broad representation from leadership around the world with varying expertise in different fields. So as you all know, we had then two regions that were created, one for the West, one for the East. And so for our working groups, we have detecting threats and patterns. And for the West, we have United States and Italy with both of our co-chairs here. For the East, we had Kyrgyzstan and Pakistan. Our Pakistan co-chair is joining us virtually. And then for the sub-working groups, which you see in the middle bar, a little further down, we have two co-chairs again for each region. For the West, we have South Africa and Canada. For the East, we have Indonesia, and we still have a vacancy for the second co-chair, but we're in the process of recruitment. And for the West, we have Colombia and United Kingdom, and Fiji and Australia. Our Australian and Colombian co-chairs are joining us also virtually. And currently we have 1,300 participants that come from 144 countries. Those are the countries that you see up on the screen. Invitation remains open for additional government staff to join the coalition and international organization staff to also join the coalition. We recently had one international organization, additional one join, the Indian Ocean Commission, that just recently joined. So actually that number should be 12 international organizations, not 11. I didn't update that. But as we have additional countries, we will keep adding flags to this list, really showing that this is a completely global issue. I still have not interacted with a state that doesn't have some issue with substance use or has faced challenges with this. So I mean, in the past, we used to say, oh, we would approach countries based on prevention if they don't have a significant substance use issue. But I haven't quite found the country that is only looking at prevention because they don't have a substance use issue. So this is something that we're focused on everywhere. The meeting schedules, which we started in October at the sub-working group, began with framing the issue, that is looking at the context of each of these sub-working group topics. And then we are currently in the second phase of sharing best practices models, identifying what those different intervention points are along the spectrum of supply and demand reduction. And then we're entering the phase now of looking at recommendations, at what the deliverables would be, and then asking countries to make commitments in terms of those initiatives that are launched. We will have a mid-term coalition working group meeting March 6 and 7. Here is where the sub-working group co-chairs will report to the working group co-chairs the progress that has been made over the past months and where we are looking at recommendations for each of these sub-working groups. And I highlight June 18, 19, June 12, 13 as sessions, although I should probably highlight February 2021, because as soon as you all return back home, apologies to the West group, you have to co-chair the meeting that's going to come up next week. And it's going to get a little bit busy over the next few weeks with meetings. But I want to highlight also the meetings in June because we are also inviting all of the co-chairs of the sub-working groups and working groups, as well as the IO coordinators, to participate in a meeting where all of the sub-working group co-chairs and working group co-chairs of all of the working groups, all three of them, will come together. So that will be about 40 co-chairs that will come together with the international organization coordinators the last week of June in Thessaloniki in Greece for the meeting of the International Society of Substance Use Professionals, where we will be looking at more of the operationalization and the sustainability and building a year one report. And so that will be focused a lot more on outcomes and achievements. But moving on, we have the evaluation period and looking at how do we transition the initiation of these activities into a longer-term sustainability track. And then we have at the next segment, the year one review of the working groups that will take place September 5th and 6th. So now we're focusing in this red circled section of implementation, and this is one of the things that we're going to be also communicating with all of you. For the co-chairs of the sub-working groups and working groups, we will be asking you all for some time in preparation of this March 6th and 7th meeting in the next couple of weeks to have a 1 hour sort of call just to get on the same page. And also because we need to discuss what we think the meetings, the 1 hour meetings from April to August should look like. And we have a few different discussions that we want to explore with you all in terms of whether these should be presentations from countries. We've received a lot of requests from countries to present, so that could be an opportunity. Whether we do actual training or sort of support from international organizations. UNODC has a wonderful policymaker training that they've done, which I think is excellent, and they have a shortened version that could very well fit into the 3 or 4 hour block that we have of time for the sub-working groups. Or maybe we want to engage private sector conversations or civil society or other sectors that we can invite. So it's on a case-by-case basis by sub-working groups. So we want to bring you all together in a few weeks on Zoom just to plan out our schedules from April to August. I remind everybody that to check in with the coalition website, globalcoalition.us. I have been promising this feature that's coming with the wall where we can all start posting. I've seen the demos of that, and it looks very promising, an opportunity for us to have accounts to make the conversation a little bit more closed. Right now, it's a completely public website, but the way that we are structuring this new segment of the website will be that if you have registered for the coalition working groups and sub-working groups, if you haven't, please do. We can send you the link. The idea will be that you will get an email inviting you to register an account, to add a password to that account, and then you will be able to see a section where we can interact with each other much more fluidly, post articles, ask each other questions, and have more of a natural dialogue. It will be a wall like LinkedIn or Facebook where we can have more of a sharing of experiences. And we will also be posting, hopefully by next week, the menu of all of the initiatives that I will discuss in a little bit. I want to highlight that we are working with different sectors beyond governments and international organizations, even though the calls that we have every month are only for government representatives or their designated actors and international organizations. We are also establishing parallel tracks with civil society organizations, and the Vienna NGO Committee and New York NGO Committee have helped us in managing and organizing that conversation. With universities, we've been working with the International Consortium of Universities for Drug Demand Reduction, and they have been convening regional roundtables in the different regions of the world over the past couple weeks, and they will continue for the next few weeks, organizing universities and with the private sector as well. And so I want to now discuss, this is my slide that the co-chairs will have seen from the January session that I just presented, but I want to share this with everybody because it explains a bit of the process of where we're going over the next few months. We are looking now at what the concrete initiatives are that we can undertake as a global coalition. And by initiatives, we mean programs, which can be actual projects, which can, have start and end dates and activities, or they can be actions that are taken by governments, or they could be policies that don't require perhaps funding resources, or it's just more of sort of action by governments and policies that are instituted independent of projects or initiatives. We, between December and January, received over 120 initiatives from international organizations and have been reviewing those and preparing those for publication on the website. And what does that look like? Well, an initiative will have the title, it will have a description, and then we'll have some background documentation or links, any accomplishments that have been achieved to date, if it's an existing activity, what the project sort of process is, how do you actually undertake it through the stepwise progression of activities, what are outcomes at the national level for a country or at the global level, and which countries are currently participating in these initiatives and who the point of contact is. And the idea is that during the month of February and March, countries will then be looking at this menu, countries that are participating in the coalition, participants, and will be identifying where they might be interested in collaborating and expressing interest, not to INL, but directly to the international partners that are leading these specific areas of work. So if you imagine that the coalition is as vast as Interpol and the World Customs Organization on the law enforcement side, and so that's very operational in what they're doing, and then you have on the other side, UNODC, African Union, doing public health interventions in different regions, and WHO. There's a vast array of initiatives. And so it really comes down to the individual that represents their government in a specific competency area of work, connecting with whatever platform is of interest. And that's why we are always encouraging every country to broaden as much as possible their membership in the coalition, to have different ministries, different sectors, so that they can all benefit from the different opportunities that are going to be highlighted soon. At the CND, we're looking at, of course, there's going to be a lot of side events, but we're looking for some dedicated space to have discussions in terms of the initiatives of the coalition and the recommendations, and present those and have a discussion. I haven't done a poll with co-chairs of which co-chairs are coming to the CND or which countries are coming to the CND. What I think we'll do is we will have a room available for sort of dedicated meetings. And then I would also like to have a meeting with some of the donor countries as well to discuss sort of how we can look at commitments. There's different ways you can support the coalition. One could be through financial commitments. Another one could be through mentorship in terms of supporting other countries and other regions where you have areas of expertise. And then the other would be just having your country participate in some of these initiatives and contribute to an intelligence sharing platform or to some of the other projects that we have. And the implementation phase of the coalition then begins April to July. Doesn't mean we end and we're done in July. It means that the projects start in July. And in many cases, start is perhaps not the right word, because many of these initiatives are ongoing initiatives that have existed for many years. So what we're doing is expanding the universe of countries that are participating in these initiatives, and then making sure that we're able to set this on a course to continue this work over the years to come. So this is not a short-term initiative. This is something where we are looking for these individual 120 initiatives to expand and grow. We have been now to the other point of recommendations for the coalition. We've been reviewing the topics from the monthly coalition meetings. And from that, we have been creating a draft list of recommendations. Those recommendations have been shared in draft form with the co-chairs and will be posted on the website in anticipation of the March 6th and 7th meeting, so that the participants in the coalition can review the recommendations and weigh in on whether these are the right recommendations, whether we should have additional recommendations, make changes. So that is something that is underway. And then on March 6th and 7th, we will, in a sense, have a presentation of those recommendations, again, open for governments to share their views, what should be in, what should be out. We're trying to come up with a list. It is not to say that this list then requires countries to adopt these recommendations and implement them. It also doesn't mean that governments can't adopt recommendations that are outside of this. This is just a notional list of areas where there seems to be some attention by governments in terms of how we should, where we should be focusing attention. And the idea will be that following March, the recommendations will be posted on the website. But as I mentioned, we're going to have an internal platform to be able to communicate. So we continuously invite governments to share additional recommendations with us, because I think that the challenge here is that there's no quick fix, there's no silver bullet, there's no easy solution to this issue. And we will continuously be looking for feedback in terms of what we're still missing. And let's check ourselves, let's doubt ourselves. Let's see if there's things that we need to continue working on. So what's the purpose of the meeting for these days? I'd like to pose that I think we want to take a stock, an inventory of what are the resources that we have at our disposal. And in the presentations today, I think that this will be clear. I think if you've looked at the presentations over the past several months, it's been apparent that there is a tremendous amount, as I said earlier, of wealth of platforms, databases, systems that exist. But we also need to look at what the challenges are. And particularly, I recognize when we're discussing this at a global level, and we have global representation here from different sectors, albeit, different regions have different realities in terms of the architecture that exists. And where we see incredible architecture in one place that's been developed in a certain space, in another place it may be completely missing. And so there's a question of, are there models that we can transfer? Are there platforms? If the goal is to have universal harmonization of data to be able to connect that and to be able to make sure that we are speaking the same language and have common definitions, centralizing some of that would make sense, I think, to me at least. But there's challenges around that as well. And we all have to realize that we all have finite resources as well in terms of building this architecture. So how do we do this in the most efficient way? And that's where we're really hoping to get a lot of dialogue and insights from the group. Where can we make the most impact, I guess, is where I'm trying to lead to with that point. And I also want to emphasize that the goal of this meeting is not to come up with a recommendation kind of in a closed session and say, this is it, this is what we're running with. We couldn't do that. We don't have all of the participating countries of the coalition here. And in fact, what I'm interested is in getting your feedback through the process of, we've shared kind of a draft document, which I can also review. I'll also review here some of those recommendations for these sub-working groups. But we can review some of these draft recommendation decisions in terms of, are we on the right track, or are we missing some things that we need to, in preparation for that March meeting? And I'll say that also the approach that we look at in terms of understanding data is important. And in sort of initial preliminary discussions that I had with Paul, with Angela, with Simona, we can look at this in terms of the international, regional level, the national level data collection systems and data collection systems at the local level, and kind of look at that tier of information going down and up, and how do you harmonize this. But you could also look at this in terms of information about the drugs themselves, about the consumers, and about trafficking patterns. I mean, if you look at these three levels and you have different platforms in each of these categories, you have different systems, different ways of communicating. And so there's a tremendous amount of wealth that I think we need to recognize and understand. It's quite complex when you consider and you kind of map out where these different platforms and systems lie. They're actually spread across all of these. And so the interaction between these substances, consumers, and trafficking, or international, national, and local levels, is also very important to consider those dynamics. So now I want to move toward the conclusion by looking at what the draft recommendations are that we have for the two sub-working groups. And I will say that these are notional. These were only come up with by our team in INL just by reviewing these sessions that we had. And I already received some comments saying, hey, you completely missed that. Of course we did, because the intention was not to kind of put everything out there, but really to get everyone's feedback. So I welcome very much to say that this is insufficient and we need additional recommendations. Please provide us with your recommendations, all those present here, and we look forward to expanding on this list. One area of work that I found was prominent in our discussions was looking at the drug composition analysis. What are the substances, what are the components of these substances, as I said in this morning's remarks. And so the idea is that many countries actually don't have the equipment around the world to even look at this. They have presumptive testing equipment, but they don't have confirmatory testing equipment like a GCMS machine. And so being able to provide the requisite equipment and training might be necessary to be able to get the data necessary to report up what drugs are actually being identified there. Second is the institutionalization of sustainable and recurring data collection systems through the establishment of observatories and regional epidemiological networks. We heard presentations about great epi networks that exist that bring together national health authorities and the observatories as well. And third is the introduction and expansion of innovative drug data collection techniques like wastewater analysis and web-based clinical screening tools through training and technical assistance. Okay. So if we look at these recommendations, the idea is below these, we have initiatives. Those are the concrete, actionable. So what could those look like? Well, for improving drug composition analysis, we have Colombo Plan's Sentinel program. We have observatories such as the African Union or the Organization of American States. We have wastewater analysis, or we have some apps like the Web App Assist. And below that, we would have achievements that would then be looked at within the coalition context. What could an achievement be? It could be a meeting, it could be provision of equipment, training, assessments, policy approval. And below that, we would look at outcomes. And so you see there increases in reporting, public health alerts, new trends detected, or platforms that inform policy. Sorry, I'm losing my voice a little bit, so I'll let you read these recommendations for 2.2 on your own. But you see there that we're also focused on strategies, action planning, legislative policy development, and looking at regional trends and challenges. And thank you very much, just in time. We'll be doing the sign language at the end.
Yes. Is Murphy Law. Both of us are losing the voice. Discussion for your presentation now or at the end? Okay. Someone can take the microphone. If you have any questions in the audience, raise your hand and okay.
Thank you. I forgot about the questions.
Hi, Paul Griffiths from EMCTDA. A really interesting and I think very impressive initiative. One of my questions really is part of the direction of travel, harmonization, standardization, linked systems, which clearly makes sense, but also I think this issue about actually how do you configure things, how do you configure approaches to meet national conditions, national needs, national context? And we know that some of the big glossy things what we might do in Europe might not be appropriate to do in other places, and some of the things done elsewhere we wouldn't fit within our context. Do you see there's a tension in that, and how do you think we can get past that?
I repeat the question. Yes, I think that's a wonderful question, Paul. If I could paraphrase it a bit, different countries, different regions have different contexts and, let's say, levels of architectural development when it comes to data collection systems. And so if we're saying, well, let's build a global approach, well, some of this might not quite fit. Think of wastewater analysis. Do we have the right sewage systems and data capturing systems? Some countries we don't. So are we proposing kind of the Cadillac version when maybe we need something that fits more hand in glove with countries? Absolutely, very critical in terms of data collection. And I think what we want to do is look at what the ideal vision is, and then identify what the course and trajectory is over 1 year, 5 years, 20 years, however long it takes, but to build harmonization at one level. Because if we don't have kind of the structure and everyone's doing their own, and countries start developing in these different directions, it's going to come to the point where we have so many different systems that don't speak to each other that will never get to that harmonization. So I'd say to look at that home, that structure, recognizing that we're all on different paths or sort of trajectories, and then working with countries where they are in what the next iterative step might be. Maybe they need first an observatory. Okay, or step 1 is observatory. Step 2 is a regional epidemiological network. Step 3 is this, and they collect certain data that they can, and others, we kind of put, on a trajectory for the future. So I think that we have to be very sensitive to that. That's a very important point. Thank you. Please.
Okay, thank you. So the comment is there are certain specific, the challenge of synthetic drugs. There are some challenges that relate to the drug problem, being a synthetic drug or a plant-based. There are certain structure that you need to put in place to address the problem. And this is also for data. There are certain things that you need regardless of synthetic and plant. And then there are specific maybe issues that are related to synthetic drugs. And so I'm wondering if we can also think, and I guess if I understand correctly, your presentation is addressing both. And then maybe to reflect as a comment on, how do we build the foundation, and also how do we deal with the specificity of synthetic drugs. But then a question on the duration. No? If I understand that you said the coalition, and I always heard that, maybe I'm misunderstood, the coalition will last 1 year. Or maybe I misunderstood. So what will happen after 1 year?
Yeah, so we've outlined a year of planning, and to get to the point of September UN General Assembly time to look at the progress that we've made within this year of the coalition. And so the work plan that we've outlined has been that. I think the idea is we've been very intensively working through this methodological process, and again, very much appreciate the monthly meetings. But also, we're exhausted by the monthly meetings. We enjoy the wealth and exchange of information. At the same time, it is a certain pace of work that is difficult to maintain beyond a year. We've always said that when you look at the operationalization of this work, we're just starting the operationalization phase from April to July. So we can't obviously be done with our work and say, Global Coalition, the work is all done by the end of September. So the idea is that we would spin off these initiatives into their natural homes within the international organizations to continue this work. And I think that there are still areas where the coalition moving into the October, November, December timeframe will need to look and intensify more of their work. The private sector is one of those. There are 6 industries in the private sector that we feel are really key to looking at this issue. We are just now starting to convene them. We have existing projects with INCB or UNODC to do that, but it's going to take some dedicated time to kind of work through some of those industry practices, standards, know your customer policies, practices. So I think it's going to take time to really get through that. So we're looking for the coalition work to continue, but this phase or this element of the intensive meetings is something that I think we would be wrapping up in September. and just maybe organize or work a little bit differently moving forward. Now having recommendations, having views, kind of moving forward. One of the things that we're also, we've been thinking about is having a thought leaders conference, maybe in October, small group, just to take stock of, what progress has been made, what's missing, where do we go, kind of into the future with the global coalition. So it's not that we're completely done with the coalition. You can't get rid of us so quickly, but also very much to speak to your issue of plant-based versus synthetics. Look, I know we have tremendous issues continuing with cocaine and heroin and many plant-based drugs around the world. The structures that the global coalition is promoting supports the entire drug control system. So it could be used for plant-based, it could be used for synthetics. There are unique things that we're looking at that are synthetics focused. But if we look at the magic ball, these synthetic drugs are cheaper to make, they're easy to acquire the chemicals, they are easy to transport, they're huge profitability, much more than plant-based. And the way that you can make the potency of these drugs interact with the brain to create this kind of euphoric that will go beyond what you can do with plant-based drugs. We can't put a year on it, but we could see year X in the future where why would you cultivate a plant when you can, for a very cheap amount of funding in chemicals, be able to produce things that have such potency in the brain? And we have to look at these organic chemists that are geniuses that are now can liquefy fentanyl, and now you've got illicit liquid fentanyl, and they can create cocktails. And fentanyl is of great concern for us, but it's not the pandemic. It's COVID. It could be when you look at sort of the experimentation of these. You could have other synthetic drugs that are produced that spread in the same way a virus spreads and can create one of these kind of global. And so it's a matter of time. And if humans don't do this with artificial intelligence, with quantum computing, we're a decade or two away before the formulas are found where these are of tremendous potency. So I think now is the time where we really have to be very forward-leaning, make sure we have the structures that we have, because we have a lot, but we have to organize all of this as well so that we're going in the right direction. Thank you.
Hello, I am sorry I arrived during your presentation, so maybe my question is a bit out of focus. Anyhow, my concern about the new approaches to face this chemical drugs is that I see a lot of attention posed on chemistry and much less attention posed to activity. So we are studying, we are facing a myriad of new molecules. But we should, in my opinion, first of all, have methods to understand which of this multitude of compounds are really effective and really dangerous. And for this purpose, I believe that preclinical studies are extremely important. And I don't see much attention posed on this focus. Thank you. I'm Franco Tagliaro. I am the former director of the Institute of Forensic Medicine at the University of Verona. Now I am in pension, but I am still active in this field. Thank you. Preclinical, animal models.
Franco, it's so nice to meet you. Thank you so much for. It's an excellent point because I think it highlights. And actually, Simona, I think one thing we wanted to do was also have the co-chairs introduce themselves at some point as well, because what I think you're reflecting, Franco, is the diversity of professions and technical experts from a variety of fields that need to weigh in on this issue. Yes, we have to look at the chemistry. We need medical examiners to know also what to look at when you're looking at these cases. We need forensic toxicologists. We need social workers and healthcare workers and nurses and psychiatrists and teachers. And it's such a vast spectrum when you look at from the what we say the 4 M's in the supply reduction world, the manufacturing, the monetization, the marketing, the movement of the drugs, and then you've got prevention, harm reduction, treatment, recovery on the public health side. And you've got so many different professions in each of those that I think what I've always been saying is there's no silver bullet, obviously, but you need to identify every single intervention point along the process of there's this much that can be made if we do nothing, and there are 50 intervention points where we can reduce the amount that ultimately makes it down to the person that sort of consumes that substance. And to be able to have an impact in these different intervention points, you need to engage the right workforces. So that's definitely something that I think we're very interested, eager for these recommendations. How do we operationalize? How do we get to these workforces that we're missing in the coalition and make sure that we can develop initiatives or bring them into this area? Thank you.
I am Sabina Strano Rossi, a forensic toxicologist and president of the Italian Association of Forensic Toxicology. I am professor at the Catholic University of Rome. Regarding data collection, and I think that there is a need of evidence-based data collection, meaning that the forensic toxicology analysis are of paramount importance in knowing exactly which drugs are used and which drugs cause overdoses. And we talk about wastewater analysis, but often data are not collected based on the forensic toxicology analysis. I think it's a point very important to stress and to give recommendation of this kind of data collection. In Italy, for example, we started to collect such information, but we know that our results are only from a very few number of toxicology analysis. It is important to stimulate the performance of toxicological analysis and to collect those kind of data too.
Thank you so much for that point. And we're so fortunate to have Dr. Barry Logan here with us, I think in his presentation, highlighting the wastewater analysis, certainly a very important data points that we need to look at, looking at the composition of the substances as well, and the synergistic effects or the compounding effects of what the drug composition in an individual street level sample. There's a lot that can be done in terms of looking at that. What I'm finding around the world is that there isn't enough analysis of what's in the drug supply. And then once you know that, then you can start tracking back, well, where are these things introduced? And then you can take public health measures and connect law enforcement to public health and have really good sort of collaboration between. So again, it's kind of everyone has to come together and work in this much more collectively because of the complexity of that toxicology and what's in the sample. Okay.
Another recommendation from the interpreters, please speak very loudly because they cannot hear this kind of mic. Slowly and loudly, okay? Roman.
Can I go first? Okay, thank you, Brian. I think just have I know that these recommendations, when it comes to how to implement this recommendation, we will have a more chance to discuss. But from the guy who was working in the field, supporting the countries, when I saw this recommendation on the forensic capacity building for the composition, identifying composition and thing, I have noticed that at the bilateral level, the countries purchase some expensive GCMS machine or LCMS machines for those developing countries. And then it was really great at the beginning, but after a year or 2 years later, this machine has been sitting there, not been utilized to the extent it should be. And often also it got broken and then it was not fixed. The maintenance issue always pop up, I think. So from the building the forensic capacity, I think it is really important to ensure that the sustainability and kind of the mentorship model instead of like one-off trainings and buying these equipments. I think that would be, it would be really great that elements to be reflected in the implementation of these recommendations. And the second point is, I think it is really great to see all this initiative to collect a different set of data, improving data, and then we are basically asking our counterparts, the countries, to improve their data development capacities and reporting as well. And often that I found that it's quite difficult to talk with the counterparts asking more data sometimes because they feel like it's much more burden for them as well. So I think it is important that how we can tell them that this will be benefit of your countries and work as well. I think that element should be, I think, also reflected in when we have a discussion tomorrow. Thank you.
Can you present yourself?
My name is Inshik Shim. I'm based in Bangkok, UNODC Regional Office for Southeast Asia and the Pacific. Yes.
Thank you, Inshik. That's excellent. Excellent points. Thank you. Yes, Roman.
Hi, Brian. Roman Serifov from the MCDA. Sorry if I've missed it, but there are 3 working groups, aren't there? And they kind of deal with each of them kind of almost in a silo. How exactly are you planning as a coalition to articulate the work of the different groups, the recommendations, and how that they speak to each other in the process of development? Because we at the MCD have been advocating this holistic and helicopter view where you see the whole picture and kind of try to put the puzzle together at the same time. I hope I didn't miss it in your presentation, but maybe it would be worthwhile if you can just tell us once again how this will articulate to each other over time, but also content and process-wise.
Thank you so much, Roman. So what's very interesting is we have 1,300 individuals who have registered for different sub-working groups, and their backgrounds are all over the map. They are covering so many different fields. So what we have found is that people will register for sub-working groups based on their work profile of what they're doing. And so we have some people that are in the manufacturing sub-working group 1.1 because it deals with precursor chemicals, but they're also in this 2.1 on early warning systems because they're working with some of the forensic labs where they're looking at some of the NPS work. And so the membership, the participants, even though we have distinct co-chairs, the participation is fluid between the groups. And what we've also noticed, because we get sort of the Zoom readout at the end of the meeting where you have all of the participants that sort of attended and how many minutes they spent online. We have all of the manufacturing, trafficking, and data collection sort of in the 4-hour block. They are consistently, they stay on for multiple sessions. So people don't kind of tune off. It's not like I only come for one sub-working group and then I'm gone. There's some consistency between that. The idea is that when you're dealing with 3 gigantic areas of work and even 7 very large topics, trying to interweave the topics together can become very messy and complex. But because we are creating initiatives or actions that are where the actual work at the end is being operationalized, those initiatives can actually meet multiple sub-working group points. So a forensic lab could, yes, fit within data collection, and it fits within manufacturing as well. trafficking, canine, drug detection program, which could be in 1.2, could also connect with, sharing in a 2.2 network of data between, law enforcement. So it's the initiatives themselves that ultimately bring together those actors that engage with that specific issue of interest. The World Customs Organization has issued an invitation, for example, for their focal points to join. And so they're in sort of their own network, and the K9 network is sort of in its own network. And so there's different networks that we're seeing when it gets down to the actual implementation are able to figure out, and the sub-working group titles blend away. It kind of washes away because they're just focused on the task at hand. It's more, I think, an administrative task for us to try to put these topics within these 7 themes, just to organize our minds in terms of, let's talk about this and that, so that we don't go crazy, kind of where does all of this stand. But operationally, I'm kind of not as concerned, because I think that these groups will find their own way. But if you have another idea, please, welcome ways that we could intersect or better connect these worlds.
Thanks very much. Charles Perry from the South African Medical Research Council, and also a co-chair on Sub-Working Group 2.1 West. A couple of issues I think you've touched on, but maybe I'll push you a little bit to go into, because I mean, in a way, your presentation really covered, I think, at some level where we need to go, and you've pretty much taken the words out of my mouth tomorrow. But I think there's some softer issues that need attention, and you did start to cover it. To me, it's how you bring all this together, and one way will be like an electronic platform, which you started talking about, your coalition website. We have to find a way to bring all these streams and have a forum for discussion, and then, collate all the information and you bring it all together. And one way also is through a platform, but another way is through meetings. And I think you already touched upon that. We used to have something called the International Epidemiology Working Group on Drug Use, which was a sort of a way for people from observatories and networks to come together annually or biannually to discuss, because the discussion is important. As you've said, it can't only happen in virtual meetings. So I think that platform, those platforms, if they virtual or in person, will be crucial to bring all this together, because so much is going on. So I'll be interested to see your website when it comes out. The other thing we've been talking about is the need for research, and that has been touched on in some of these talks, because we need to understand what's going on with the drugs themselves, as was presented. We're often behind the scenes catching up, and we're missing half the story. But I'll be interested to see what happens with the university coalition, because I think there are topics which need further examination, and that takes time, and hopefully there'll be some funding for that kind of work. But I think there's also a need for rapid responses, because like you have in the drug field, in the infectious diseases area. So it's interesting, we're meeting here in this building, and I think in infectious diseases, we send teams sometimes to go in somewhere to do a rapid situational assessment. And maybe we'll need some kind of capacity for doing that in this field. We don't tend to do it. We wait and then we react. So I think there needs to sometimes be more intensive going into a certain area where something is changing to get a rapid understanding. Thank you.
Thank you, Charles. So many great points. I think research is crucial. Let's see what comes out of the university network discussions. I think that's one area of work that the International Consortium of Universities for Drug Demand Reduction, that's one of their core areas of work, is bringing universities together to conduct research. But there's so much that can and needs to be done. also interested with infectious disease platforms. Are there existing platforms where we could add the issue of substance use to some of the, why recreate something new if there is sort of infrastructure there already, and not look at non-communicable diseases? Now we're starting to deal with the issue of, we need to, and this has always been a big challenge, we need to mainstream this issue of substance use into general public health, into ministries of health, where oftentimes it's not an issue that rises to priority, and yet it's so transcendental for public health, for community safety, for so many different development indicators, where we need to elevate this and say this should be in the basic package of health services, if not the extended package of health services. So we do need to elevate this more. With regard to the issue of how do we sort of look at this at the regional levels, and I also am very much admire kind of the International Epidemiology Working Group. I remember Zilli speaking about it, Sloboda, for so many years, and how great that network was, and seeing how we're trying to do this at a regional level with the Pan-African Epidemiological Network and the OAS with their observatories. And there's many regions around the world that are coming together regionally. I think that could be a recommendation, for example, that you all could put forward, saying we should kind of reestablish something like this. What we're looking at is making sure that we have at least the conversation ongoing in every region of the world. And we have a lot of regional international organizations that convene already data collection or public health or around the issue of drugs in the Americas, in Africa, in Europe. In Asia, there's some networks, but there's still some that I think need to be developed. The Pacific is one region where we haven't seen some of that coming together in terms of data collection systems and structures. The Middle East is another area that we're very interested to engage, and Central Asia is another area that we think, be very interested to see how there could be more sort of work there as well. But I think there's still some architecture to create at the regional levels, but of course, then that needs to be connected at the global. So would very much look forward to what your recommendations could be on that. Yeah, okay. Thank you all so much.
Super thanks, Brian. Now it's the time of Dr. Angela May, the Chief of Research and Trends Analysis Branch at the United Nations Office on Drugs and Crime. Please, Angela.
Yes, tell me how. It's very fancy. When I came and I asked Simona, I said, what kind of room do we have? And she said, it will be a big auditorium. So I thought at the time at the university, I'm not from Rome, I'm from another university in Padua, but basically we have the same. And I thought it will be a cold auditorium with very uncomfortable chairs, etc. So I see that after 30 years and more, that's definitely more comfortable and very fancy. So Brian has asked me to, kind of give an overall ideas of where we are, why we are here, in terms of more of the, not the process itself, that of course is under Brian's responsibility, but more in terms of information. And so, first of all, we have to say, why do we need information and what do we need it for? So, and I try to, put blocks, understanding that these blocks are always, when you try to classify, is always limiting. But I have divided in terms of, what we want to understand is the size of the problem, the patterns of the synthetic drug problem. We want to understand the harm in different forms, not only health, but in all of the different forms that are caused by synthetic drugs. And then we also understand the response. And overall here across demand, supply, markets, meaning bringing it together, criminal justice, etc. But ultimately, we want this information to describe and mostly to predict, to understand the threat, so that we can be prepared. We were, chit-chatting at the coffee break with some Italians, but I have seen it. We had in Vienna an expert meeting on synthetic drugs couple of weeks ago. And it was interesting to hear that every country that would speak would say, we haven't seen fentanyl yet, but we are looking for it. So it's interesting to see how what is had happened in North America has translated the knowledge, the information has translated so much into threat preparedness all around the world. And maybe the new threat will not be maybe fentanyl, will be something else, but it's really interesting to see how this has helped to really, what we always call threat analysis. So how do you hear? So what do we need for this? And so I try to synthesize. I'm sure you will find something that is not here, but in terms of what I would call source of information, of data, we need such a multitude set of processes and data collection systems. And I'm not going through all of this, but this is just to give an idea on the complexity of the things that are needed. From population surveys to administrative data, from the criminal justice system, from the health system, but also, as you all have mentioned clearly this morning, forensic laboratories, but also private sector information that is needed. And overall, with all of this constellation or architecture of data sources, what we would like is that they're all comprehensive. So when we talk about hospital records, all the hospitals are included. When we talk about overdoses deaths, all overdoses are included. We would like to have interoperability because, you all know, the drug problem is an interaction. It's not that it's only health, it's not only supply. So we would like interoperability across all of these data sources. We would like these data sources to be very disaggregated, so that it's not only a general picture, but we understand, for example, not only men and women, we also want to understand subpopulation groups, for example, for health. We would like all of this to be timely, so that, we get the information when the problem, often we get the information when the problem has already evolved and has already changed. So we need just to realize that is a very demanding system that we need. And even now we are speaking in Italy, in Europe. Think about what you have in other parts of the world where you don't even have the registration of deaths, let alone the type of deaths and the causes of deaths. I think we need to keep in mind that is the highly demanding process that we would need. But so if I take one lens that Brian mentioned, the way how we can see this, and I took if you want, geographical lens. So from, this information, basically, most of this information is produced at local level. But then how from the local level is pushed to a national level and then to a regional and international level. So we need work at the local level so that the resources that we mention at the local, being hospitals, being police station, so it needs work at the local level to make the sources robust. But then, if they remain at local level, there is no point for national policy. And so how do all of this move at national level? And of course, at national level, you also have you need the capacity to bring it all together. And so you need coordination across all. You need digitalization is throughout. And then you also need at national level, what I would say, institutions that they have a convening power. Because everybody, that's what we always say at the UN, everybody wants to coordinate, but nobody wants to be coordinated. And so at a certain point, it brings it together. You need that in a way has that convening power to coordinate and to set the standards for the local level. At the same, then when you transmitting from national to international is the same. At international level, at the regional level, you need the capacity to absorb. You need the capacity to set the standards. You need the capacity to bring it all together in a meaningful way. And so what are the challenges across all of this? And I mean, you can see there, I'm not going through all, but local level, low capacity of digitalization, low capacity to recording also. At national level, often what, at least if I have to assess, one of really the weakest capacity is analytical capacity. Analytical capacity is something that goes beyond, if you want, just the work of doing 1 + 2, and then, but to really make all of this information, and both at national and international level and regional level, by the way. And often I tell my staff, I say, we need to make the data sing, not just speak. We need to make the data and the information that we have sing. So how do we have that capacity really because otherwise the data per se have no value. And so then when we move at the global level, the challenge is that, the biggest challenge that we see at the global level is that where we have information, the drug problem seems much bigger. So we all know the 100,000 deaths in the United States. We have no idea how many people die of overdoses of drug-related in Africa or in Asia. And maybe the problem is, maybe not, I'm saying, equally large, but, it might be much larger than what, because when we don't see it, we always tend to focus attention on where you see it. But then what are the challenges in moving the information? As I was mentioning, the moving information from local to national. And here the challenge is mainly weak national coordination capacity. And weak coordination and that power, if you want, to also standardize at the local level. But also from national to international, also there are a lot of challenges. And the biggest challenge is when we see it at the global level is that if there is no coordination at national level, then of course you cannot have it at international level. You know how many times we have maybe some countries, they say, oh, but you are publishing a different data on what I have. But then we said, well, this data was given by somebody in your country as well. So we can't solve the problem of coordination at the international level if that is not resolved at national level. But there is also, and this really, again, you need to think of it, we are speaking, now we are in Italy, but in the most high-income country, I would say, maybe not all, there is the political will to share. In many regions, culture, institutional culture, there's no political will to share the data, the information. And so again, think about, now I'm thinking about trafficking, for example. Some countries are really seen as the bad country, that a lot of production, a lot of trafficking, etc. But because they share the data and the information, maybe in other countries much harder, to understand because there is really no willingness, not only the capacity, but also the willingness. So then Brian asked me, can you map all the initiatives that were at the end of the agenda? So I tried, with all up to your judgment. But so I said, how do I map and what is, again, the structure that I can use? So using this, again, the structure from local to national to level, I thought, well, maybe, there are certain initiatives that support the flow from local level to national level. Some initiatives that support that is not only the flow, but also the sharing of information from national level to international level. But I would say in aggregated form. So information that are mostly aggregated. So total number of or total weight of seizure or total number of people use drugs and these kind of things. But there are also initiatives that in a way try to move from local directly to international, more with what I would call event-based information. And so in a way to overcome this weakness that sometimes the local never gets to the regional and international, but also because the nature of information that is needed for the drug problem is really very refined. And very often, and more, for example, we are seeing at the international level, aggregated level information do not really always help to address very refined questions. I'll give you, when I show you the initiative, then I'll give you some examples so you understand. But there are also initiatives that in a way try to go on the other direction. So in a way to try to support, so what I would call capacity building initiatives, so that from the international region trying to support the national level, so the countries, and all initiatives that try to support countries to actually help the local level information to build up. So let's look at the mapping. So again, apology for those, the corner on the right, because I don't know them all by heart. So I try, and again, apologies for some of maybe initiative that you see that are not in the right, happy to change. But basically, you see, I mean, here, a lot of initiatives that basically move at the level of looking at how from national level to get the information at regional and international level. But also from the local level, I mean, from the local level, for example, is the observatory model. So, you know, trying to build a national observatory level. So again, from the local to the national. But then also from the national level, as you can see, that there are many. And the big question, I will say it at the last as a question for the audience. I mean, maybe there are some synergies. And for example, I can tell you that we don't have here, because it was not in the list, but for example, the African Union has a data collection system for Africa that includes pretty much the same information that we include when we ask the information at international level with ARQ. And there is another, I mean, you mentioned it, the information on the drug epidemiology, the initiative of collecting treatment data. This will be 3 times that an African country would have asked the same information. And with countries where there is very little. So I think the question also for us is to say, well, you know, with all of this, what is there any synergy that we can think? And, you know, standardization, and do we really want to put all our you know, to disperse all the efforts into little, or do we want to think about how can we bring all of these efforts? Because all efforts are useful, important, brilliant, all. But the hard question, and often beyond all of this, there is an institution, and of course, my institution, your institution is the best, is the one that always, you know, produce. But how do we have, and I'm wondering if in this 2 days, 3 days, we are actually able to move out from this, and we are really trying to think about these hard questions. But you see also a lot of initiatives that try, that's what I was mentioning, moving from the local, going to national, but also from more. And this, I take the example because I know it by heart, because it's what we do in UNODC, the drug monitoring platform. So many countries, it's even harder for countries to produce an aggregated data on seizure. And so what basically the platform does is to take single seizure events based on either reporting by member states or through open sources and bring it all together. And I can tell you that, for example, the information, the way now how we are looking at drug trafficking flows, we can look at only through much better with this type of system that, for example, we do with the ARQ, with the aggregated data, where we can answer the other question. But the idea, and here you see there are many, there are all the INCB, you know, and each look at different things. We look at seizure. There is the ICB that looks at precursor. Then there is the ICB that look at the sharing intelligence. And they are all, again, as I said, of course, they all have their right, and they all answer different important questions. But here, again, is an attempt to map them all. there is also the information that I was saying that there are some initiatives that actually look more at what I call capacity building, so to support countries. And then again, here you see some less crowded, definitely, but some other, initiative that try to move it down. So now I want to finish with these questions because I guess that's what we have the questions. So where are the investments needed? Where is that is needed out of all of this platform? So it's an issue of increasing awareness. So to involve, and I think Brian, you mentioned countries that can join this activity. So to make them more visible and to more appreciate the value that why as a country I should, I don't know, report. I don't want to use a UNODC example because it seems that otherwise but I don't know why as a country I should report to an INCB platform. What is the advantage? So to make more clear the incentives that there are for those to participate in those networks. Improve accessibility. Some of these platforms are not open, are restricted. I mean, there are some good reason to be, but maybe can we find again, maybe different way of accessibility so to maximize the use of them. As I was mentioning, increasing exchange motivation, provides incentives, increasing coverage for synthetic drugs. I mean, many of these initiatives do not focus on synthetic drugs, but maybe, to see there are some things that maybe can be put in effort so that this platform, improve their coverage of synthetic drugs. And again, I was saying earlier, improving synergy, avoiding duplications. How can we rationalize these platforms in a way that, the same thing is not reported many times, but also to limit the burden of those that report. Then, if I see a lot more on supply than in demand. Maybe for the nature also of the way how to exchange information, because trafficking has a much stronger transnational element than maybe demand. I mean, I'm not saying that demand does not have a transnational. And that's why probably this have emerged more, but that's a question, to balance. But also what is missing from this architecture? And particularly, and to me, what is missing is the use of the data and the analysis. That is not just research. Once you have, for example, a national observatory, it's not just to put the data together, but how do those data are really used to understand the problem, to address the problem. But also from the capacity building point of view, is more on, how this help really to standardize methods. But standardizing in a way, what I will call culturally sensitive. I mean, we have seen, for example, that for drug use survey, in the majority of the part of the world cannot use the same methodology that is used in Europe or North America to ask people to report drug use. We have done an experience in one country that there's a lot of use of drugs where with a sample of 35,000 people, hardly anybody reporting use of drugs. Women, 0, 35,000. So it's clearly, how do we provide those standards that are culturally sensitive, that, take in consideration the different. And again, what is missing? Is there something that we are missing in all of this, that maybe in some of this initiative that would be useful? With that, thank you. So do I stay for the question or I can? Yeah. Questions? Okay. Even if you presented before, present once again for the interpreter. Thank you, because they don't see you on the camera.
Thank you. Hi, Paul, again from the Monitoring Centre in Lisbon.
Still there.
Still there. at least for now. Really, I think impressive presentation. It really sort of laid out the landscape. One of my, questions is if we look to the future, simply through demographic changes, cultural developments, globalization, industrialization, the big drug problems of the future are likely to be in the global south.
Yeah.
Yet many of our methodological approaches have been developed in Western countries, very different cultures and contexts. And if we look, I guess, back, you know, I'd probably, when I was working UNODC 20 years ago, I'd probably be saying much the same things and describing not a very dissimilar situation than you are talking about now. Why do you think we failed a little bit to translate some of those approaches to the global south? And do we need to rethink a little bit some of our methods and models to make them more culturally appropriate to countries that have very different contexts for information connection? Because my slight worry is that we keep repeating in some ways the same exercise and wondering why it doesn't work. And maybe that what we're not putting enough investment into making culturally sensitive and acculturating our methods to different contexts, rather than, I think the standardization debate tends to push you to, you know, let's do a big survey and it works in the US or it works in Europe, so why doesn't it work in, you know, Kenya or Afghanistan?
Yeah. Now, I think, do you understand you're challenging that we should have a global approach to information system?
No, I'm suggesting that maybe we need to, or asking for your views, is do we need to invest more a little bit about how we take our methods and make them more appropriate to different contexts? Or do we sometimes, have we risked kind of taking models that are appropriate for Western contexts and not adapting them sufficiently to the challenges of collecting data in other parts of the world?
Yeah, no, but of course, I mean, yeah, I think, but you said well, one thing I would challenge you, Paul, to say, because you said there's not change from the 20 years since you work at UNODC. I would say there has been some changes. And I mean, I think we have made some progress. I mean, not the progress we would have liked, definitely. And there are, and indeed, how do we make this more sensitive? I brought the example of indeed the collection of drug use, but that's where, to me, there is a lot that is moving from that pink line from the local directly to the international, less than going through the traditional. You go and one, and then a national, and then the countries report. And more granular information that we didn't have 20 years ago. And in that respect, I think some of the forms, but this is not only on drugs, is in everything what is happening, the data revolution, there is a lot that is moving away from the traditional official reporting and official flows that we have, and more that with this more event-based data system, where statistics are generated more from all of this, what we call, big data, rather than to go. And that, to me, that's why there was so much on that pink line. And that, to me, is the evolution. I mean, the wastewater, in a way, is also, you skip the national, you go directly to the local, and you try to get a picture that is not only national, but also international. And that's where all the data, if we were sitting here talking about, I don't know, mortality in general, would be the same. That's how the world is moving in terms of information. But there is also an element that we have not engaged, and that's where I would say some of this also regional or initiative. How can this help to do it together so that we serve all the same objective of taking this at a regional international level? And we have seen, for example, with ARQ, that when we have brought together countries in West Africa and literally sitting together behind the computer, where they can come with their notes, and then they can fill out some Of course, not all. Some of their key questions, that's where we have improved a lot of the information. So how do we all work together so that all also the efforts that we have, they are not just parked for, if you want, a simple international, a simple institutional interest, but we all move to the same so that the same information has only one channel and not 3 or 4. Yeah.
One moment. The interpreters kindly ask you once again to speak loudly and slowly, okay? Because they cannot see you. They see the speaker, but they cannot see you, so they cannot see your mouth. And so please. And another request is to declare your investigation field or your position. I'm a biochemist, I'm a chemist, I'm a lawyer, I'm the chief of this, of that. This is their request and the request from people online. Okay,
Sure.
Thank you. Thank you very much. Sorry.
Thank you for the great presentation. My name is Grant Baldwin. I direct the Division of Overdose Prevention at the U.S. Centers for Disease Control and Prevention. I'm a behavioral scientist by training. I was really struck by your point about using data to serve and drive action and how we need to do that better. I have 2 questions. I wonder if you could comment on something that I'm really worried about in the United States is telling success stories about the use of our data to drive action and its impact on real people as, you know, not just in aggregate, but I really do feel like to the general public, the just average citizen of a country, they need those stories to really understand the importance of this. So I would love your comment on that. And then my second question goes to one of your last points about how in lieu of surveys on drug use patterns, how we can leverage big data, social media, web scraping, and other technologies to understand, because in the US, they do provide really good insights on emerging drug threats and how we can, and to the Paul's point, I mean, I do think there is some element of lowest common denominator that we need to be attentive to, but when the technology exists and social media is everywhere, it does feel like a place where we can take advantage in a very passive way to understand drug use patterns. So thank you for the great presentation.
Yeah, can I pick it from your last question? I think it's a very good question. And that's where also in a way, that's what I was saying, the supply side has evolved in this, taking advantage of this social media, any open source, using in a way data science in order to mine, to absorb the data. There's no equivalent for use. And if you tell me where, you remember again, there's a pink line from the local to there's all supply. There is almost nothing on the demand. And that would be, to me, a gap that to see how can we build also some certain systems that can understand drug use. Because wastewater tell us about consumption, doesn't tell us about use. And I think it's important to understand the pattern of use, who use and how. And now I know, EMCDDA, I guess you are doing now an online survey. But again, we always have this attitude of, because that's what data collection has been traditionally, that we go and ask, we go and collect. While now, with the world that we live today, there is a lot of reporting or information out there. So how just we harvest rather than collect information, but clearly. The other point is, and that's the challenge, I think, and I'm sure, I don't know your example, if we are all scientists here, we are all challenged by this question and say, okay, but show me why is important. Tell me the story that would have saved a life if I had that information. And that's another thing where we need to get better. I don't have an answer. I know that we need to get better showing the value of the data to action. If I may say, on our side of scientists is the issue of communicate better. Another thing that we are at least working a lot, and I see this for UNODC, is to evolve in how to visualize, how to communicate. Our executive director always tell me when I go with the World Drug Report, tell me what is the minister message, the message that I can give to the minister. And in that, definitely we need to get better. I mean, you don't always have to ask questions. You can have the answer yourself.
Roman Serifov from the EMCDDA. Angela, same question that applies to Europe from your perspective. How do you see, to what extent is all the data, the knowledge, research you produce being uptaken by policy indeed and implemented? To what extent? There is a great demarcation between what we do and policy, not to mention politics, but let's keep it on a policy level. So what is your assessment about your work at world level?
Well, I'm a bit biased. So the data that I report is by definition biased because you ask me about the work that we do. But I tell you that, for example, as all of you that work, we have our indicator of achievement. So every year we need to report on what we achieve. And in our reporting, imperfect, because answering your questions is very difficult. And if I really, as a scientist, I should say, well, I don't have all the information to answer, but I can give you a bit of a piece. And for example, one of the things where we look at scientific publication, how many in the scientific literature cite our own work. And we only take the World Drug Report. And every year is increasing. So that for us is a sign that somebody is using it at least for scientific publication. Another indicator of achievement that we have is on how many strategies or resolution. For us, international level is international resolution or strategy, national or international, that use the information that we publish. And again, every year, because every year you have to show an improvement, we see that there is more uptake. Is it enough? Well, that's a question that you have. The other thing that we look at is downloads. People that at least read it. Well, download doesn't mean reading, but we see again, last year we had a 30% increase. We reached about 6 million in a year of between views and downloads of our publication. These are just the tip of the iceberg. I think the big question is, I think you can answer better than I can do, because of course I see always good uptake, but the judgment, And I'm talking about the World Drug Report mainly. But not only. For example, we have done a global cocaine report, had a lot of uptake also. The other thing that we look is media. Again, is enough? I don't know.
Okay, Angela, thank you very much. I am Hetty Widyastuti from Indonesia as the coordinator of the Communicable Disease and Rehabilitation of Narcotic on Director General of Corrections. We deal with prisons. Thank you very much for your excellent presentation. Also, Brian, it's so brightening, and perhaps as you present just now, we need to build something that can fulfill our needs. If somebody asks, is this important? Perhaps I can give the brief information about what happened in my country. We deal with 270,000 inmates, and more than 70% sentenced with narcotics. So it's something that so it's the sentence, but you can also figure out how many of them is with background of narcotic abuse, but not sentenced with narcotic. So this is disaster. Okay, thank you very much for UNODC. We built the data system in Indonesian, correction data system. We call it System Database Pemasyarakatan, which contains of information data about inmates, all data. And UNODC has helped us to develop our health and rehabilitation data in the SDP that is I mentioned. So we are now have our system which can communicate with the national system which developed by the National Narcotic Board. I don't know. I hope I can say it clearly and you can have the information right. For us, with what I already listened with your presentation, we need to build trust from countries. This is data, this is information, and this is very sensitive. Not if you tell country to give the data, to build the data system with formula that us give them, perhaps there will be suspicious. What's in it? What happened if we develop, and is it belong to us, or you put something inside it and the data will be not belong to us. I think it's important because when we built our national data system, it's so hard to make ministries believe that this is inside our country. If we talk about narcotic rehabilitation, we talk about Ministry of Health, Ministry of Social, Ministry of Law and Human Rights. It's not easy to make them approve to send the data or to make us, all of us, is simply trust that, okay, this is our need to provide the data, and the data will be used to give us the positive impact to what do we need. And you can imagine if we talk about our country, it is difficult. How about if we make it regional and global situation? So, and also continuity. So if I can suggest, perhaps we can let the countries build their own system of data information, but we can communicate or enforce them to build the data system with data that we need to integrate it. I don't know, how can we say it in English? So the data can be collected, but the countries feels that they are not ordered to do that. Because it's just about integrity, right?
Yeah, yeah.
We talk about somebody integrity.
Yeah.
And I think with Indonesia, I just give you the example of Indonesia because we are so big country. We are contained of 38 provinces, 416 districts, for 280 million citizens. So it's so difficult if we start from local side.
Yeah.
Because it's very partial. So when we built our system, we start with the, I don't know, the local can give the example, but we need to make it as attention for our head leaders.
Yeah.
Leaders. So we need to make it together. We need to get close to the national level. So Brian has mentioned, like, we make them notice about this process, and perhaps not decide yet, but okay, this is needed. So we make them sit together, but we also need to make the steps to, technical, what do you call it, Brian? I read it somewhere. Technical assistance, yeah. Get it. Thank you. Thank you, Sarah. Yeah, we do the leader commitment, but also make the technical assistance, which perhaps can be very different for countries' need. So, and perhaps I can make also suggestion for we make the roadmap. I think we cannot answer all questions, but we can make priority. And priorities might be different for countries, but we can make roadmaps for 5 till 10 years ahead, because in my experience, we cannot do it in just 1, 2, 3 years. Let's make it 5 to 10, and we can, even it's not all, but we can achieve something. Thank you very much.
Well, thank you very much. I think you raise very, very important point that I think we need to, if I understand correctly, you remember when I show you all the initiatives, a lot that focus on going up, very little coming down. While you're saying that, all you need, we need more support. While we all, we, because I'm thinking about as a, international organization, we always push and want always data and information. But can I ask you, and I think you raise, again, I think a crucial question that it would be important to address. How do you think we can increase that trust that you mentioned? You said that not in a way that is order. What can, can be done here in groups to increase that trust to share information?
Thank you. I think Sheikh already mentioned, we need to hear from countries. What do they need in their situations? This process probably from us to them, but let make them feel this is our will to listen to them. We still will guide the way, but not ordering.
So to really listen. Yeah.
Yeah, because you also mentioned, right, when we all want to coordinate, but none of us want to be coordinated, right?
Yes.
Okay, perhaps.
Thank you.
Mike Evans-Brown from the EMCDDA in Lisbon. In your presentation, it's more a comment really. but in your presentation and Brian's presentation, and for the next few days, we're going to be talking about a lot of novel approaches to data collection and so on. And one of the issues just raised now about trust. And in your slide, you presented things like electronic healthcare records, wastewater, event-based data. It all starts with people. And one of the things that we need to discuss is ethics and data protection and gender by default and by design in all of this, because that's where trust begins.
True.
And that's where you
True.
get the best data from.
True. Brilliant point. I think the issue of data ethics is something that we have always under covered, definitely.
Ten minutes more, and then we have to go for lunch. Take in mind.
One quick point, Grant Baldwin again, U.S. Centers for Disease Control. Just to amplify the point that was just made, in the United States, we've really struggled. We have a better partnership now between public health and public safety and law enforcement than we ever did in the past. But one of the challenges that we've experienced with sharing of data between law enforcement and public health is the fear of individuals being prosecuted as a result of that data sharing. And so that's something, to your point, that we have to be very sensitive to in the interest of public health, trust breaks down very quickly in that situation.
Brian Morales from INL. Thank you, Angela, so much for the presentation and for the comments as well. Very, very rich. Yes, I think that the points here made on ethics and protection are crucial to the discussion. You know, in building trust, I think also building responsiveness to these tools is the challenge, because how do we get countries to report consistently and not just, and we talked about, you provide the equipment, they provide for a while, it breaks down, they stop reporting. There needs to be also, I think, a recognition that this is of continuing benefit for those that are producing the data, that in producing the data, they are organizing their work in a way that is helpful for them on a recurring basis. So they're not doing it for us, they're doing it for themselves. And when they see the value in it themselves, then they will keep doing it for themselves, because now they've connected to a platform or to platforms that help advance their work. So I think the design of how we structure these global networks so that they're responsive to the day-to-day work of the individuals is really key, with all the appropriate protections to make sure that we are looking at that. But I will say, maybe, Angela, if you could speak a little bit to how we deal with reporting fatigue. I think of smaller countries that get bombarded from different international, regional, report here, report there. And I'm hoping that we can find a way to simplify, harmonize what you report to the Organization of American States MEMS process. The CCAT Observatory can then also come to the UN, and you don't have to double report. Because I think that what I heard from the Caribbean is we spend our days and nights just reporting, and we're exhausted by this task in smaller states. How do we sort of address that?
I think I've been trying for many years. Paul would know, because I try also. And we are now, little by little, at least starting talking about for Europe, for the European Union. I think, I don't know, is breaking down, not breaking down, data reporting becomes also a power of an institution. And so if I'm talking about international organization institution. And so it's like if they're giving up, or if they merge, or if we do this together, that diminish the role of an institution. And I don't know how to change that narrative. And what is the question is, what incentives can be given to us to work together? I can think about one, but.
I think is it me next? Great. Claire Amal, Deputy Director of Drug Strategy in the Department of Health in the UK. I'm an economist by background, but now primarily responsible for our expansion of treatment. So in a much more kind of policy and ministerial facing role. And I was very struck by what you said, Angela, on making the data sing, not just speak. And I think I do probably see ministers once a fortnight on a range of issues, including this. But what is clear is that we absolutely need the data analysis that you say, but also really thoughtful engagement on presentation of that analysis. And I think in some ways, COVID has both helped us and hindered us there, because it's really raised the bar for visual data representation, for kind of alert systems based on risk and scaling threats. And so I think there is, certainly an expectation now from ministers, if you're scaling this on 1 to 5, what's the threat level, whether it's a number, whether it's a color or RAG rating, that kind of synthesis of the data into a 2-sentence version within an assessment that's on a scale is increasingly the ask, and a challenge to us all.
I think you said it very well. That's the challenge, and that is a skill that we need to develop.
Just a couple of comments. Paul Griffiths from the Monitoring Centre.
Still there.
I'm still here. The first one is the point about ethics. And when I think back to wastewater, which we've really kind of pushed and pioneered against huge resistance, not only from policy, but also from the field. I mean, survey researchers, for example, were very scared of it at first. One of the critical things was establishing not just a technology of the method, but an ethical framework. And it was one of the big initial investments. And separating the work, the operational work, some countries wanted to use it for operational purposes, looking at oil rigs, and some countries looking at schools. And we made a big separation from the research purposes to operational uses of the method. And we developed an ethical framework very quickly. And we also developed a communication framework so that we could sell what the method did and what it didn't do, and reassure people both in the field and outside the field. And I think that was critical to its acceptance. The second thing, and I think I was slightly misunderstood when I was talking about big systems. I think we need to be careful of not assuming the methods that we've developed historically in the West are going to be sufficient for the future. But I do think new technologies are coming up with all sorts of new options for data collection that didn't exist in the past, and they're often much more rapid. And I know, for instance, some of the companies monitoring GNP, so they're looking at economic surveillance. They're not just using the government figures, they're actually sending people into shops to photograph what's on the shelves, and they're using that data to inform actually a more granulated picture of what's going on. So very much support what you said about that. And lastly, I mean, and I think this is Charles's point earlier, it's about, and your point about analytics is, what do you do with this stuff? And it doesn't matter how much data you've got. It's never enough. There's always lots of uncertainty. It's always partial. You never know what's coming down the line. And whether it's at the local level, whether it's at the regional level, national level, or at the international level, you really need to get the data in the room with experts and discuss what it means, what it implies, and really how are you going to use it to inform your policies and actions. And I think that critical human element is often forgotten. So it's really, it doesn't matter if you're working in a country, data-rich country or data-poor country, and we've all had experiences going to places where they don't have a lot of formal data, but when you talk to the experts there, you find out huge amounts of what's going on. There's lots of trapped knowledge. So I do think, as well as our technical systems, our use of new technologies, we really have to invest in the human analytical capacity that actually makes this information sing for the purposes actually we're collecting it, which is to influence policies and actions.
I like this expression, trapped knowledge. It's true, we have a lot of trapped knowledge. How do we, think we are ready for lunch.
Yes.
Oh, how do you do that? Can you do it here?
See, Angela, if I can do from here.
Ah, no, it's dentro.
It's the announcement. I repeated many times. Please speak slowly and loudly. Okay.
Thank you. Thank
So-
you. That's a very interesting discussion.
Thank you very
And we
much.
learned, yeah, I think we picked Brian because we were discussing how can we, to me, what I take learn from this discussion, I think I think it's important to think about the ethical and the data sharing, and this building of the trust. And to me also to reflection to think about this, how to build a faster, I mean, as we have a lot on the supply, I don't know if this came from me, but also I thought it came also during the discussion. How can we also think about maybe innovative ways of having platforms more relating to building from local to international, national on use? That's what, thank you.
Thank you, Angela. Okay, it's now lunchtime. Some practical announcements. There will be gluten-free, vegan food. If you cannot recognize it, ask me. I mean, when you see couscous, you can understand, but the others, if you are not sure they are vegan, vegetarian, ask me. We will start in advance so that in the first afternoon, thanks to the sun, some of you can go for a walk after the meeting of today. So we will start again at 1:45 p.m. Okay, and stay here because before the starting of the afternoon meeting, I will explain to you where we will meet tomorrow. Not here, okay, but in the back side of the institute. I will tell you later on. So have a good lunch. Thank you.
I actually think hardest versus trying to do some of this stuff on your own. We have some legacy systems at CDC, like our Whisker system, that is built on its own visualization, and it's like, you know.
During we had Enrico Fermi and Borin Chain, Daniel Beauvais, and finally the well-known Rita Levi Montalcini. And who knows in the future, you know. So one of the room is entitled to Dr. Beauvais, and you will enter, go straight forward. We were waiting for you, and we will stay in a room which is smaller than this one, so we can have a sort of discussion all together. Okay? So, I invite Dr. Paul Griffith, where is Paul? Okay, to speak about regional experience in data collection, EMCDDA.
I am this one, last one. Is that me? You launched it, and do I know how this works? I do. Hi, everyone. I'll try and speak loudly. I'll try and speak slow.
Ah, sì. Ora sì, sì. Sa. Yes, thank you.
Okay, can you hear me now? Okay. So what I want to do a little bit this afternoon is to talk about perspectives from a regional perspective and look at really, I think, a number of objectives for this presentation. One is to set the scene a little bit, talk about how changes and some of the challenges we've seen in terms of the modern world related to synthetic drug use has posed a challenge for monitoring systems at the regional level, and I suspect more generally. I want to consider how we've addressed those problems in Europe, and I want to briefly review the information sources we use in Europe for monitoring and how they have evolved and changed over time. And I want to finish by considering a little bit what are the lessons learned and maybe some of the implications for monitoring systems more generally, and to hopefully to inform some of the discussions we're going to have tomorrow on the detail of how we move forward. So I think one of the things, and the reason for this meeting is we all know the world has changed a lot, and we really need to keep up. And I think often when we look at what we're doing in terms of drug information systems, it's been a struggle to keep up. We know that globalization and digitalization is impacting on every aspect of modern life. So it's not really surprising they've also impacted on the drug market and the drug problems we face. We see that drug problems have become more dynamic, more complex, and more globally connected. And at the same time, they become more interconnected and tangled with other broader range of other important contemporary policy concerns. And some of those are obvious: housing, homelessness, mental health comorbidity, but some of them are less obvious: terrorism, effects on the environment. Increasingly, this means, I think, we need information systems configured to the needs of monitoring a more complicated and joined up world and informing the development of more complex and interconnected responses. And this is all happening really fast. So the speed of change is ever increasing. We've seen the rapid diffusion of innovation in drug production and use. This is creating corresponding need for more rapid information systems to inform policies and actions. I think post-COVID, and this is something that's been across the science area more, but generally in Europe, we've seen the need to anticipate and pivot rapidly to address new policy and operational challenges. Globally and at the EU level, there's been a really interesting debate recently about the need for a new science policy ecosystem, and I point you to the work of the Global Evidence Commission or some of the stuff coming out of JRC or the European Commission, some of the stuff we've done at the agents level in terms of EU answer, really that we need to work more iteratively, and we need to work in a more co-production model, recognizing that different sorts of information, different sorts of evidence are going to be useful at different points in the knowledge cycle. We need to move more to platform models and away from pipeline models in terms of our information collection and reporting. And also, I think this is something we discussed already this morning. Technological developments create new challenges for us. Over the last few years, we've been looking at how we monitor drugs in the darknet. Increasingly, we're looking at how do we respond to the fact most drug markets are now potentiated through social media apps. Real challenges for monitoring. At the same time, we're seeing these technological developments actually resulting in new opportunities for monitoring. So I was looking at some very interesting work using AI systems to interrogate online discourses, using sentiment analysis. So we've got new tools, new possibilities, but we've got new challenges and new environments to navigate. And what does that mean from the implications of a drug information system? Well, I think we need to react more rapidly. This is key. We need to do that, we're going to need new methods and new approaches. We need to be much more proactive and future-orientated in the way we work. We need to be looking over the horizon, responding to new trends, not just looking at the problems of the past. We need to adapt our classical approaches to these new challenges. So if we're looking at many of the indicators we use, I'll say a little bit more about that in a moment, they're very much configured to the drugs problems we were facing 10 or 20 years ago. We need to make sure that they remain fit for purpose in response to modern drug problems. We need to communicate more rapidly and in different ways and to a wider set of audiences as we address these more complex and entangled policy challenges. And I think fundamentally this is co-production is a key. And there's lots of reasons for that. And some of the reasons I've already said in terms of this new ecosystem for science for policy and action, but also it's because many of our main information providers are also our main information consumers. And this is why these platform models are more important. We're working with groups who not only provide the information that we need to share, but they also consume it in terms of targeting their work and their activities. That applies particularly to practice, but it also applies too in the policy sense. For us in Europe, that's very much our RealTalks community. That's the network of national focal points. But increasingly, it's also professional networks, those involved in data collection, but those also involved in both in the security and the health space in operational work. And it's also with civil society, it's with affected communities, and increasingly with people who use drugs. And also, faced with these global problems, I think we need to be more globally aware. So we've got a set of challenges, I think, for information systems. And we see those really, and we've heard a little bit about it this morning, synthetic drugs fall right in the middle of that. They are a concrete illustration of the modern problems we face. And we see a number of reasons that they can increase profits and reduce risks for organised crime groups involved in their production and sale or trafficking. They exist in a very fast-moving market that is quick to innovate to meet demand or mitigate control measures. That market is increasing globally connected and digitally enabled. They can produce near to consumer markets or in areas where regulatory controls are weaker. And they can be highly potent with small volumes representing potentially many hundreds of thousands of street doses. And when you put that all together, these features all create new challenges for law enforcement and public health. But they also create new implications for surveillance and information systems. We are increasingly faced with the need to rapidly monitor an ever-changing and growing list of substances, mixtures, and chemicals. Self-report data, which has been the mainstay of many of the tools historically we've developed, have become increasingly less reliable or not sufficient in itself. Often people are using substances that they don't actually know what they used or may be misinformed. There's a Xanax bar at the bottom of this slide. It's actually a fentanyl product. Or they may be using mixtures of substances, and some of the harms arising from that use comes out from the mixtures and the interactions between the substances they're using in combination or in close succession. But we often lack the forensic and toxicological capacity to monitor trends and trends in availability and use. And many of the current methods we have are drug-specific. Many of our reporting systems are drug-specific, but many of the problems we're increasingly facing comes from the interaction of the consumption of multiple substances, either together or in the same location or in the same context. And just a way of a very brief example, we've had huge media. I think I've done about 20 media interviews on this subject. We've had people from the member states coming to us. We've had a lot of questions at the moment about this sudden and rapid emergence of nicotine opioids. They appear in different forms and mixtures. Some of them are made up to look like street heroin. Some of them have appeared on synthetic cannabinoid smoking products. Some of them have appeared as medicinal substances. They're highly potent. They probably first appeared on the European scene around, we think, 2019, but they really only came on the radar in the last year or so. And we've seen problems elevating rapidly in 2023, so literally in the last months. And in the past, if I was talking here in a meeting like this, talking about drug problems, I'd often be presenting data that's 2 or 3 years old, talking about new problems that were probably 2 or 3 years in the past. 2 or 3 years ago, we hadn't even these substances on our radar. We've had outbreaks of multiple overdoses and lots of overdoses occurring in a very short time and overwhelming local response measures. They appear to be driving increases in mortality in some countries. But our capacity to identify these substances through routine monitoring is currently very, very weak. And the question really is, how as an information system do you need to respond to these challenges? We really need to think, what is it that we should be doing in this space to be useful, to helpful, informing both the policy response and the operational response. So that's my sort of setting the scene. Now I want to stand back a bit and say a little bit more institutional, how these things manifest in how we respond to drug monitoring in the European context. That's our office in Lisbon. It's a very nice building. We're very lucky to be by the river in a very pleasant location. If you haven't visited us, please do. So I'm going to give you a very, really simplified top level of what's really happened in terms of the development of the European system. Well, the MCDA was established in 1993, operational from 1995 in Lisbon, and very much it came out of concerns arising from the heroin epidemic that overtook many European countries in the 70s, 80s, 90s, and 2000s. And the real focus of that work was a need to our regulation is very much was then about standardization and harmonization of data. Really, the idea was to create a common language at the European level so we could have a similar policy debate in terms of European responses to this problem. And it was based mostly at the beginning around key indicators, so the traditional epidemiological tools for which drug use has been classically monitored. Very quickly, though, from around 97, the first early iteration of the early warning system was introduced, and that came out of the fact that ecstasy MDMA had appeared and really struck policymakers a little bit, blindsided policymakers, and we realized we also had to complement our current system with more reactive methods. And there we started looking more at case-based data, open data sources, rapid reporting and rapid response model was developed over time. Risk assessment and risk communication became important topics for us. And it was also linked to a fast track control mechanism at the European level, which also gave it a lot of policy relevance. And across this period, I think policy concerns were also changing. The world was becoming more complicated. Some of the things I've already told you about. So the whole, as well as the health area, security area, became increasingly important for us. Newer, more timely and sensitive information systems needed to be developed. We started working on those. There's much greater focus away from the opiate drugs, just heroin, onto the drugs like cannabis and stimulants, synthetics now becoming more important, the MPS and polydrug use patterns. And the last few years, we've also incorporated, particularly after COVID and reflecting sort of broader European developments, a futures and foresights approach into our method. And if you stand back from that, where that all comes together is from June this year, the new EUDA will replace the EMCDDA. It's much easier for most people to remember that name, the European Union's drug agency. And what you'll see, I think, in our regulation, it's not just focused on monitoring, standardization and harmonization of data, which our original regulation was. It gives us a far broader range of competencies reflecting these changes we've seen in the problems we face. And a lot has changed, but some things fundamentally have not. And we've talked about this already. the data in the drugs area is always partial. There's always uncertainty. It's never going to be sufficient. It's never going to be good enough. So we've always been multi-sourced and multi-method, and we recognize that is a key aspect of our approach to inform analysis. We've always worked in close partnership with member states. As a regional body, you're in fact facilitating national and really local level data collection. So we've always, I think the key and probably the unique selling point of the centre has always been the ability to have an ongoing dialogue with member states and national networks. What does this mean? Are you really seeing this? How do we understand it? Those sorts of questions. And with expert networks, increasingly with expert networks. And we've always been recognised with the customer-centric boundary organisation. So we work at the boundaries between science, policy and action, and we always want to be scientifically robust. We need to be impartial in our analysis, but we really have to be useful. So we're never going to be perfect. We have to communicate, I think, uncertainty that comes with a lot of the data, but we have to create with that information analysis that informs policies or actions. And just to say that, because people talk about the early warning system, they talk about the response system, really we see this as all part of an integrated knowledge system for supporting evidence-based responses in the drugs area. So when we started off, we were very much in the routine monitoring space. It was reactive but robust. Over time, early warning and threat assessment became much more important for us. This is more proactive, but much greater levels of uncertainty. And recently, we've also incorporated foresights, which is very speculative, high degrees of uncertainty, but really allows us to inform some of the decisions we make in terms of our early warning system and our routine monitoring system, how we move forward. And the reason there's this little spinning graphic in the bottom is not just because I was really pleased to get it to work, which I was, but more to remind me to say here, the point of these things is an integrated information source. You've got different outputs for your information. You can go off into an early warning risk communication, go into a more policy thing. You can look at the analysis of trends over time, but they need to inform each other. So what we do in the early warning risk assessment area has implications for what we do downstream in terms of our routine monitoring. We need to add new codes. We need to adjust the targets of our monitoring. When we look at our foresights work, it informs some of the decisions now. If we think that might be a future problem, what do we need to do now to mitigate it? Where do we need to be looking in terms of our early warning work, our threat assessment? How do we need to change our basic core monitoring systems to be ready for future challenges, not just simply responding to the challenges of the past? I'm now going to say a little bit, sort of just give you a quick overview of data sources. I'm going to say a little bit about the routine monitoring tools. I'm going to say a little bit more about the innovative approaches we've developed over time, those still in pilot and developmental stage. I won't speak about our early warning system because Mike's going to elaborate that tomorrow. And I won't talk about a lot of the developments we've seen recently in the security space because Rumen's going to talk about that in detail tomorrow. So the key epidemiological indicators, in the old days, it was 5 key epidemiological indicators were like sort of our 5 commandments. It were things that we concentrated on in terms of our data collection. And I think they're all still relevant and we still need to invest in them, but they need to do adaptation to ensure that they remain fit for purpose. So if you look at something like the our drugs-related deaths indicator, it was very much developed at a time when we want to focus on heroin-related deaths. It's configured to that. It hasn't really kept pace with the need to look at some of these things like that illicit benzodiazepines used in combination with heroin may be now driving drug-related deaths. So we need to develop these classical approaches to remain fit for purpose. And then over time, we've developed a number of complementary approaches. They all have methodological weaknesses and limitations. They rarely provide population-level estimates, but they can be extremely useful as a complementary data sets, and they're often where we see the first signals of important developments of change. So it's where we really get a look at a little bit ahead of the curve in terms of what's happening. They're complementary to the early warning system, and they're often network-based. So importantly for us, we're working with external networks who are working in that space, and then we're helping to inform it by adding a data collection and analysis layer. So I'm not going to say a lot about wastewater because we're going to come to that again tomorrow and discuss in a little bit more detail. But we were a very early adopter of this approach. There was a lot of resistance to it over time. It's now become a classical epidemiological method. It's now being used extensively for disease surveillance and things like COVID and other conditions. It's really come of age. But we were very much an early adopter in the drugs area. And it allowed us a very rapidly, almost the ability to report in real time. So if you look at COVID, we were able, using wastewater studies, to show changes in drug consumption patterns literally at the same time they're happening over periods of lockdown and post-lockdown. Angela mentioned web surveys earlier, and web surveys are really interesting because really, you know, in terms of classical survey design, they've got a lot of things wrong with them, but what they give you is large samples of drug users and allow you to look at, in a granulated level, at consumption patterns in a way you just can't because you don't have the statistical power in most surveys. So you have to interpret them with caution, but they can be very useful. They can also be very cheap, and they can be applied in settings where self-report data may be difficult due to cultural or other reasons. And you can do clever things with them. This is a pilot study we have at the moment where we're mixing a online survey with the collection of hair samples to add some toxicological background to toxicological data to the self-report data and compare the two. So you can, with some of these methods, you can start building them up and using them in combination. With the synthetic drugs, I think, as well as we've got challenges around some of the synthetic opiates, around the tox data, the deaths data, deaths indicator, but often these drugs manifest themselves first and more regularly in emergency room data. So we've built up a network of emergency rooms. That's started as a small project, and over time, more and more emergency rooms are coming in that. It's not a full range sample. We don't do the sampling all year. We concentrate on set periods in the year for reasons of cost and practicality. But again, we see important changes over time in the drugs that are appearing in the emergency room setting. This was an interesting new data set, and this is the one that rarely, I've been around for a long time. I'm very rarely that surprised when I look at some new data, but this was one of the ones where I thought really challenged my preconceptions. When you look at syringe residues across Europe, what you see is they're not what you think you're going to see. Firstly, they're highly divergent. Secondly, the stimulant drugs play a much bigger role than you expect, and polydrug use is the norm in the residues we find in syringes. So if you look at Glasgow, cocaine was found in 80% of syringes. If you looked in Budapest, it was a cathinone. Yeah. Drug checking pilot. At the moment, we're working with drug checking services. One of the things about drug checking services, not all countries have them. Politically, they're quite in disagreement about whether they're a good or a bad thing. What they do provide is a window on recreational drug and some more marginalized drug consumption use from a community setting. And again, we're seeing some very interesting data emerging from these systems because they reach parts that our other information tools don't reach. Similarly, we're working with the network of drug consumption rooms in Europe, trying to help them in the terms of their organizational process by also adding in a data collection layer. They benefit from having our support with data collection. We benefit from having an insight into the kinds of drug use they're seeing in a very marginalized community that is very hard to reach by other means. So just to get to the end, July this year, so headline. Second, the goodbye EMCDA, hello EUDA. We have a new regulation. And if you look at it, parts of it are very similar to our old regulations. So still, we've got their monitoring, standardization, harmonization, all our key tools. But now we extend the early warning and risk assessment system to all drugs. It's not just about NPS anymore. If you look at the areas we have to address, it's anything you can think about in terms of the drug situation, but also other relevant drug-related issues and the consequence. So a much broader set of policy targets are recognized as important for our work. Interestingly, we have to recommend appropriate and concrete evidence-based actions. So it's not just about data collection and reporting, which was our original mandate. It's also about solutions. How do you use the data to inform your policies and actions? And we have to do that in an efficient and timely manner. And we have an increase in resource and new posts to do that. And I think one of the exciting things, because we've been saying this, and Rumen here, Michael, we've been saying this now for at least a decade, is we really need to strengthen in Europe our forensic and toxicological resources. We need to have that back capacity, and we need to, crucially, to link them to our epidemiological work. And we now have a new network of forensic and toxicological labs. It's going to also include the Joint Research Council, has quite sophisticated technological capacities. And it's going to work very closely with other networks, both internationally. I know there are other international networks, the UN network, for example, that we have to interface with. But important for us, we can finance specific projects that member states themselves don't normally do in their routine work. We can look at more in-depth analysis of toxicological cases. We can do forensic autopsy. We can do all sorts of things that we couldn't do with our routine reporting system. And the other thing I think is a big focus of our new mandate is, and it's also a focus of a lot of the European approach more generally in the public health and security space, is increasing preparedness. And I think this comes with a lot of reflections after COVID. So increased investment in early warning and threat assessment systems. I said that's now extended to all drugs, so much more important in our body of work. We also have a more proactive investigative model, so we'll have the resources to go out and follow up on what we think are important new developments, be they within country. And we also have a new requirement to conduct regular foresights and futures exercise and reflect on that, how that informs both. The point of doing these futures exercises is not to predict the future, it's to backcast and say, what do we need to do now in terms to be better prepared for future problems we may face. And so that now is, you cannot develop policy within the EU setting anymore without doing a futures foresights exercise. It's regarded as a key component of the good policy formation process. And in the drugs area, we need to do that regularly to reflect on what might be the future challenges and how should we be preparing now to mitigate them. And just to give you an example of that, there's a lot of discussion at the moment we're having in terms of what's happening in Afghanistan. We see a rapid and looks like fairly substantial actions by the Taliban to cut down on drug production, opiate production, but also methamphetamine production. And the question is, what's going to happen down the road in Europe in terms of heroin supply, and what might happen in there in terms of synthetic drug use, in terms of synthetic opiates, and asking those questions at an earlier time, and then putting in place the monitoring and response systems we need to actually be more ahead of the curve to identify changes if they are coming and introduce mitigating measures. Well, that was my sort of rapid overview of the European drug monitoring landscape. And just to finish on one slide, reflecting a little bit for our discussions tomorrow, what does that mean in terms of wider implications? Well, I think the first one, I think the lessons we've learned is that regional systems need to be anchored in national and local systems. They don't make sense if that's not the case. Really, co-production, partnership working and mutual added value got to be key things for a successful system. But I think what we can say from our experience in Europe is that what you can do by having strong regional systems, you can ensure sustainability of national investments over time, because countries, if they're investing in a regional system, it tends to be more sticky than if they're just doing national efforts, which can often change or be underfunded in a difficult year. And we can also help improve capacity over time. I think, and Angela said this morning, it makes no sense in terms of duplication of efforts and in terms of having a consolidated and coordinated approach globally if we don't contribute to international efforts. And part of our new mandate, we have to make sure that we're providing data to the UN system in ways that reduces the reporting burden on our member states. It makes sense for everybody. But I think importantly, what we do in Europe is configured to our context and needs. And I don't think everything we do in Europe is appropriate to do elsewhere. In fact, when we've tried to do some of the things we do in Europe in different countries, they haven't always worked in some of our capacity building efforts. So I do think you need to configure your information systems to your context and needs of different areas in the world. But I think in doing that, we do recognise that many of the underlying issues remain the same. So many of the the issues we face in Europe, we might address them slightly differently, but the same problems and same issues are common wherever we're collecting information in this area. I think there is clearly value in sharing different methodological approaches. We've already seen that there's a lot of new methods coming up, new opportunities, and we really need to be talking about them together. And there's clearly value in sharing information on new threats and developments, because increasingly these are global things that are happening in one part of the world very rapidly, transcend national borders and appear elsewhere. So fundamentally, as drug problems are more globally joined up, we need to ensure an equally joined up response. Thank you. And that's all I wanted to say. Questions?
Thank you, Paul. That was very interesting. You mentioned at the end, the need to share new threat. And how can we do this? Because we are used, the thing that you show where you say the monitoring, etc. In a way, I mean, always imperfectly, but we know a little bit how to share data, how to share information. But the sharing the coming threat, this foresight vision becomes more difficult. So any thought?
Well, I think there's a whole, since we've got more interest in foresights and futures, one of the things you recognize that it's not often when more scientific disciplines feel at first very comfortable, because it seems a little bit like crystal ball gazing, and they get very confused, but is it modeling? No, it's not modeling. And it's about looking at possible futures. How do we avoid the more negative ones? How do we try and steer ourselves towards the more positive ones? And critically, what do we do now to prepare for those things? So it's not about the future, it's actually about informing your policy and operational choices in the now by thinking about what could be coming downstream. There is a body of techniques and methods now growing. The JRC has a Futures Competency Centre. We have a Commissioner for Futures and Foresights in the EU. And it's become recognized as something you peg into your system. It builds resilience. It's something you should do as an organization to make your staff more sensitive to possible change. And it's something you do at the systems level to try and make yourself more resilient to possible future developments. And I think there's a lot of tools out there that you can use for that. One of the things we've also found by engaging these futures exercises with our stakeholders, be they policy, be they practice, our national focal points, you actually create an ongoing discussion, a shared conversation, and it's a really useful communication tool in itself. And beyond that, I think one of the things you also realize that you sensitize people to is that professional experts tend to get narrower and narrower in view. But we know, especially in the drugs field, many of the problems that are going to impact on us in the future are coming from outside the drugs field. They're becoming developments in technology, they're coming in trading, changes in global transportation routes. They're coming from things we don't normally think about. But by thinking a little bit about what they might be, we can then think about how they might impact on our work. And that, I think, makes us more prepared and more resilient to future change. And if you look out there, we have now a futures toolkit. So we give a toolkit for how to conduct your own drugs futures exercise. And the JRC has a more general policy toolkit of tools. And there's some very good specialist futurists who can work with you to help shape what you do in this area. You have to, especially with more scientific audience, you have to sort of get past a sort of credibility question. But in fact, once people do it, they immediately begin to see the value of it, especially in terms of developing forward-looking policy perspectives and organizational structures that are more resilient to change.
Thanks, Paul. Charles Perry from the South African Medical Research Council. Just one thing, you said so many things which were great. I just want to pick up on one point. you talked about co-production of knowledge is key, and you started talking a bit about policymakers and practitioners and that. And as you said that, I was thinking about drug users in co-production. Then you went on to talk about affected communities, and you've been at EMCDDA for 20 years, 18 years, something like that. To what extent do you think we need to also be engaging more with users, not just getting information from their syringes, but actually in discussion with users?
Okay, I think first co-production is key because it's actually an efficient way of collecting data, because you're working with the people who have the information, but also who need to use the information. And you can leverage that to actually get buy-in from that group, because it's useful to them too. And if you're collecting data and it's not useful for the people you're asking the data from, it's not a sustainable system in the long run. In terms of your question around people who use drugs, there is a specific line in our new regulation that we have to develop appropriate engagement mechanisms and products for people who use drugs, especially in terms of information giving, but also clearly in taking terms views coming from that community and how we shape services, or how we very useful as a source of information, what's going on, but also understanding about how we configure better services and better responses. So it's hard baked into our new regulation. It's clearly there's a lot of challenges in doing that in a way, especially as an information collector in an appropriate way. But I think it's a very important thing to start building in. And also with more in our regulation now, we have to engage more with civil society. It's not something we've done a lot of in the past, but I think it's critical. And again, it speaks to this broader debate in terms of the need with the distrust of experts, post-COVID, in a post-truth environment. This new idea that for a science policy ecosystem, it must be much more inclusive. You've got to work with affected communities. You've got to work with your patients. You've got to work with your key stakeholder groups, and you've got to work much more iteratively with them in terms of infusing the discussions with data and information and evidence, but recognizing you're part of that process, you're not apart from it. And I think that's a real challenge in terms of us in the sort of science evidence community, is how do we not stand apart telling people what to do, but actually get involved in the practical business of developing policies and responses in really messy, complicated areas with multiple outcomes of interest and multiple stakeholders, multiple views, like the drugs area. Or wicked problems, as they're sometimes called.
Definitely a wicked problem. Grant Baldwin, US CDC. Building on your last point, I wonder if there are some lessons learned from the COVID predictions in a futurist perspective around crisis communication, and how do we sort of leverage some of those lessons learned as we use predictive analytics and forecasting in our work?
Ooh, good one, difficult one. I think from the big thing about COVID was how do we respond to actually something that affected society more generally, but actually affected our world very quickly. And at our level, the first thing that we did was realize that we actually became a point in we were an actor in the information process. So we were very careful that we engaged with ECDC, that's our CDC in Europe, so that the information we were giving out was the information that they were giving out. So we were subsequent to that, there's been quite a lot of work in terms of cross-agency and about how do we respond to crisis more effectively as a community, a European community, a policy community, because the things that were happening in the drugs area were part of what was happening more broadly. And so, there was problems with providing health care generally, and that had particular implications for providing substitution opiate agonist therapy. So we had to sort of downscale that. I think there was a need, what we realized again, it was a need for accurate, rapid information. In terms of what we've been doing since then, I think it's been looking at really how we build these regular foresights and exercises into our planning, both internally in the organization, but externally. And also we're funding now some deep dive technology reviews. So we're looking at things like the impact of future technologies, wearables, AI, both in terms of the drug market, but also in terms of research and surveillance and how we do that. We're looking a little bit about what might be, if there's changes in the cannabis regulation, what might be the broader issues at the EU level we're not thinking about now in terms of differences in regulatory approaches between countries, trade, protecting health and safety at work regulation, all these things that you don't normally think about in your first policy analysis. So we tend to take it in two ways. One is a sort of back scoping. So what could happen in the future? How do we now start preparing for that or thinking how we might respond to it? And then the other one is a sort of deep dive exercises to say, what haven't we see these sorts of developments coming? If they come, what are the things we're not thinking about now that we need to think about? And there's been some really, not in the drugs field, but in the other parts of other agencies. So for instance, some of our sister agencies have been looking at things like 3D printing and what's the implications there for waste disposal of cartridges or for possible health risks linked to some of the waste disposal processes. There's lots of things you don't immediately think about future changes that could impact down the line, that by anticipating them now, you can become more resilient, I think, to change. But it's at the EU level, it's something that's been increasingly seen and really elevated after COVID, is that we need to be more agile and rapidly able to pivot to new policy and operational challenges, that really we can't be sort of complacent and think everything's going to take a long time and then tomorrow. I mean, we've seen the same with the developments in Ukraine. We've had immediately policy requests of what's going to be implications in terms of population movement on treatment services in neighbouring countries. What are the longer term implications of that? So you get these questions that you don't really expect to come along, but as an information system, you need to build in some agility to be able to say, okay, we've got a set of tools here. This is a new problem, but how do we apply it to this new question? Not a great answer, but it was a hard question. Sit down. Thank you.
Thank you, Paul. See, we are trying to keep the slides smaller because if there is the connection with the Zoom, è uguale. So, ok. Sì, per favore. Ok. Very good. So it's my turn. Good afternoon, everybody. I will illustrate how the Italian early warning monitoring of new psychoactive substances work. And I hope this will be an example of best practice. Since we try to get all the example from EMCDDA and apply in our country. So this is the story of SNAP, Sistema Nazionale di Allerta Precoce, the Italian for early warning system. It's SNAP. So. Perché non mi va? Aiuto. Ragazzi, non mi funziona. Okay. So, as everybody knows, the European early warning system is now at its 25th year of existence. And it's now formed, actually currently, up to July 2024, by 28 member states plus Turkey and Norway. And it carries out the EU risk assessment of new drugs through its scientific committee. The organization, and I don't want to steal the slides of Michael, but okay. But as everybody knows, the early warning systems works with a three-step approach. The early warning from any of member states, so the preparation of initial report spread all over Europe, the European member states, the preparation of the risk assessment and the submission of risk assessment report, and finally, the control measures, which are applied by any member states following the national laws or the possibilities that politics offer for the control measure on new psychoactive substances. And following this organization, this is the flow chart of SNAP, of the Italian early warning system. At the top, we see the Anti-Drug Policies Department of the Presidency of Minister Council, when there is the national focal point and the international coordination of SNAP. Then there is our institute, the National Center on Addiction and Doping, and we are the operation managers of the system. And up to this February, because with this February, we end this first part of the Italian early warning system, because due to the coming into force of the EUDA, we will have a change, but up to now, we have been helped by 5 operative units. The first, the Central Direction of Anti-Drug Services for the police forces coordination, the coordination and management of biotoxicological and analytical aspects carried out by the forensic toxicology of the Sapienza University, and then 3 coordination and management units for clinical and toxicological aspects, located in the north of Italy, the Anti-Poison Center in Pavia, in the center of Italy, the Marche Polytechnic University, the Department of Forensic Toxicology, and the south of Italy with the Department of Health, Sicily region. And then we have all our collaborative centers, so the Ministry of Health, the Italian Medicines Agency, the Regional Health Department, Regional Drug Addictions, Liaison, Police Forces, hospitals, and last but not the least, the forensic toxicology units at the different Italian university, which now will form a compact, important group for the new early warning system, starting in a couple of months, hopefully. So as EMCDDA, we are organized in 3 steps. First, it is the early identification and information exchange, coming from Europe to Italy and coming from Italy to Europe. So there is an input and an output. Then the risk assessment organized in different documents, and I will explain to you afterwards about these documents. And finally, the measures. The measures in Italy are the inclusion of new psychoactive substances in the tables of the Presidential Decree 309 of the year 1990. We will see afterwards in details all these 3 steps. So let's talk about the SNAP documents, the types and the recipients of this document. Let's go from the bottom. First, two documents which are released monthly. The informative document is formed by all the seizure by police forces within the month which is present in the informative documents. For example, all the seizures of new psychoactive substances and new trends of classical drugs, for example, very high concentrated THC, specific new adulterants, for example, the case of xylazine, but also pink cocaine, which is MDMA, ketamine, 2CB. So all the new patterns of drug use present in the seizures of police forces. These form the informative document. Then we have another monthly released document, which is called the communication from EMCDDA. We collect all the new psychoactive substances communicated by EMCDDA in a document that we will see afterwards. These green documents goes to the Alcohol and Drug Program divisions, to the Ministry of Health, Drug Agency, Center Networks, and police forces. No more recipients. This was a decision of the Department of Anti-Drug Policy because they believe that a lot of information regarding new psychoactive substances can create, an idea, a stimulating information, and they can go and try. So these are reserved documents. Then we have three kinds of alerts. Alert grade 1 in yellow. This is a risk of social discomfort. It's a document containing, for example, an example was the purple drink, the codeine, with soda, which created a risk of social discomfort. Then we have alert of grade 2, the risk of minor damage to health, the risk of diffusion of substances into the illicit market, for example, light intoxication. And most importantly, alert of grade 3, serious harm to health, severe intoxications and fatalities due to new psychoactive substances, adulterant present in classical drug preparations, fentanyl epidemics, and so on. The three alert documents are released in 48 hours after the SNAP receive the information from Europe or within Italy. And in this case, the recipient, apart from the former ones, are also all the anti-drug services, all the hospitals, all the emergency, urgency departments, all the anti-poison organizations. This is an example. It is in Italy, but I would like to show you what we send. This is an example of communication. You see here the molecules released in a specific month, and then for each molecule, all the physical, chemical, and pharmacotoxicological information, and also the analytical methodologies with which you can identify this substance. This is an example of communication. This is an example of informative document, only the first pages. There is a summary with all the seizure, number 1, number 2, number 3, and then for each seizure, all the information, also with the pictures of the seized material, respecting, in any case, the anonymity of the information. So we try to keep the information informative, but also sensible to the data sharing. And this is an example of grade 3 alert related to the first time the police forces found fentanyl in a case of fatality, but also in the crime scene, they found the powder. So we informed about the crime scene and also the physicochemical, the pharmacotoxicological and analytical information regarding the substance, which created the grade 3 alert. How do we share the information? By an online platform, the snap.iss.et. We have the online platform which prevents any loss due to human error. Every user has to validate the access. So we have a username and a password only for the collaborative centers, and that's it. And then there are different grades of accessibility to this platform. You see, this is the workflow on the left on how the platform works. But more specifically, this is the complex workflow we use for our platform. There is an input to Snap and an output of Snap towards Europe and other member states and towards all the collaborative centers in the nation. And this is a screenshot of the platform. When you open the platform, you have all the possible information regarding seizures, alerts, documents released by police, but not everyone can have all the information. This platform is based on more than 260 collaborative centers throughout Italy and more than 600 registered users from the 20 regions forming Italian peninsula. We are the administrators of this platform, but the Department of Anti-Drug Policy are the verifier. So they let us include information and send the information to the collaborative centers. The police forces are seizure editors, and they can display all the reports. And finally, the collaborative centers, they can add reports, they can add information, but they have only access to their own reports and the monthly reports we share to everybody and to all the alerts. Everyone has access to the chemical database, which is very similar to the EMCDDA database with molecules, the chemical information, the pharmacotoxicological information is up over there, the analytical methods to analyze these substances. And this is how we share the information throughout our peninsula. When we implemented this platform, we noticed that with the passing of the time, we received more information from Italian collaborative centers than from EU, because we implemented the how to share the information. We instructed collaborative centers on how to implement information. And I have to say that 75% of our information come from police forces. On what are we informed? The NPS identified in Italy since 2016, when our institute took the operative management of the early warning system. Well, the majority of information is related to catechins, synthetic catechins, 22%, synthetic cannabinoids, 14%, and opioids, 8%. Remember this information. And these are the substances which were firstly identified in Italy by here and then communicated to EUMCDDA, mainly synthetic cannabinoids and synthetic catechins. Regarding our output documents, 36.8% are alerts, but of these alerts, the majority are grade 3 alerts. So we have many severe intoxications and fatalities. And then once we had the early identification and the risk assessment, we have also the measures we applied to stop the drug supply. And this is the presidential decree which concerns the legal disciplines of narcotic drugs and psychotropic substances, together with rules for the prevention, treatment, and rehabilitation of the relative states of drug addiction. In this decrees, there are 4 tables to include the psychoactive substances. Table number 1 for the most dangerous and most potent substances: opium, cocaine, amphetamines, derivatives, and in the last years also the NPS. The table 2 is only devoted to cannabis products, table 3 to barbiturates, table 4 benzodiazepine. They are as a function of the potency of psychoactive substances. And then we have the tables of medicinal products containing psychoactive substances. 5 tables. These are the rules on how to prescribe medicines containing psychoactive substances. And our institute prepare the reports to go to the Ministry of Health to include the substances in these tables. And with the passing of the years, the number of the ministry decrees increased with the increase of new psychoactive substances circulating in Europe and in Italy. And we included mainly synthetic cannabinoids, synthetic catechins. One of the most important actions we organized at the Italian early warning system, thanks to the funds of the Department of Anti-Drug Policy, is the distribution of methanolic pure standards of new psychoactive substances throughout Italy, once per year or 2 times per year, depending on the money and the accessibility of substances, because sometimes it's not so easy to import substances from America. It's a little bit complicated. I think this is a very important operation. We support 77 laboratories throughout Italy, from police forces and from forensic toxicology laboratories, but also hospital laboratories, so that they can implement their methodology of analysis. Each year we select the most sold psychoactive substances, or the new psychoactive substances coming into the market. Once we distribute the methanolic standards, some months later, we prepare a quality control program for the pharmacotoxicological laboratories. We send to them hair samples and saliva samples, oral fluid samples, spiked with new psychoactive substances, sent months before. Why? To verify, to assess the performance of the laboratory analyzing the new psychoactive substances. Why don't we send blood and urine? Because we have a very strict regulation to distribute blood samples and urine samples throughout Italy, and because it's very expensive. So sending hair samples and stabilized saliva samples throughout Italy is costless. And this is an educational program. This educational program does not stop laboratories of analyzing classical and new psychoactive substances. It's for them just to verify if they implemented in a good way their methodologies to analyze new psychoactive substances. Let's go to some hot topics, global hot topics and national hot topics: fentanyl and fentanyl analogs. As I told you before, synthetic opioids reported by early warning system in Italy represent only the 8% of all the new psychoactive substances referred to our system. Specifically, from June 2016, SNAP has detected 10 fentanyl analogs in Italy. 3 or 4 of them related to deaths. Please help me, Giulio. 4 others from routine analysis of biological samples of drug users, and 1 from a seizure. And fentanyl itself was reported starting from 2015 only in 5 intoxications and only 7 different stages. And if you see, the reporting stopped in 2019. We will see afterwards why. This is fentanyl itself. Regarding the deaths. Since 2017, we had only 2 reports of deaths related to fentanyl analogs. 1 in 2017 due to ocfentanyl. I have to specify that in 2017, ocfentanyl pure standard was not available in Italy. So we have to wait 1 year more to have the pure standard and to verify that the death was due to ocfentanyl. And then we have another fatality related at the principle only to furanyl fentanyl. But then when hair sample was available, the analysis of hair sample found other 3 different fentanyl analogs in the hair of the consumer. Only 2, why only 2 deaths, only 2 fatalities? These were the only 2 reported. This does not mean that we maybe had only 2, but this was the case in which autoptic biological matrices were available. Because as Professor Strano-Rossi said before, the forensic toxicology units, also the hospital units, our laboratory in the institute, can analyze only the autoptic biological samples released by the prosecutors, available for analysis, paid for analysis. We cannot analyze the fluids we don't have. We don't have available. What actions did we put in place for the fentanyl problem in Italy? We released, starting from 2016, 22 different documents on fentanyl and fentanyl derivatives identified in seizure, intoxication, and death in Europe and in Italy. And we also released many alerts. Plus, we released 5 communications on fentanyl and fentanyl derivatives from Interpol, Europol, International Narcotic Board, distributed to our network and relevant institution in the country. And some days ago, we released once again these 5 documents because there is, a fentanyl alert in this precise moment all over the world and in Italy, in Europe and in Italy. So we released once again the famous purple notice from Interpol, which explain the protocols to be applied in case of exposure to a synthetic opioids presenting a lethal risk for consumers, law enforcement, and first responders. We put many fentanyl analogs in the table 1 of the presidential decrees, but finally the Ministry of Health took the decision to include all the fentanyls as a class and to describe inside the presidential decree all the possibility to stop a fentanyl analog from distribution and selling in Italy. So we didn't include them with their specific names, but as a class, with the substitution in phenylethyl group, the substitution in piperidine ring, the replacement of the anylyl ring, and the replacement of N-propionyl group. So we closed all the possibility to include any possible fentanyl, because we learned the lesson regarding the catenones. Now we started to include 1, 2, 3, 4, then the imidazole group, so they synthesized the other groups, keto, imidazole group, and which were not included in the table. So finally we said, how can we solve this problem? Well, including all the possible chemical substitution of fentanyl molecules. Then we sent 23 different pure standards of parent drugs and metabolites to our laboratories of the collaborative centers, and we organized 2 different proficiency tests. And we tried to publish at our best the meta-analysis of fatalities, intoxication, and also some methods of analysis to be distributed to the labs in Italy and outside Italy in order to analyze, for example, fentanyl and 22 analogs in different biological matrices. But we arrived at July 2023, when we received a document from the White House regarding fentanyl adulterated or associated with xylazine response. The United States had communicated the high important problem of xylazine adulteration of fentanyl. But we don't have so much fentanyl in Italy. So what could we do? Well, xylazine. What is xylazine? Xylazine is a sedative, analgesic, and muscle relaxant. It is not an opioid, so it is not responsive to naloxone, and it causes severe injuries that may require amputation of the limbs. This is the reason why it is called the zombie drug, because you see all the skin full of injuries. Did xylazine arrive to Italy? Yes, it did. The first drug-related death associated with xylazine in Europe was in UK at the end of 2022. It was recorded in UK. This summer, EMCDDA sent us in the middle of August an email telling us that in a newspaper of the Sardinia island, a journalist reported 5 fatality cases in a weekend of heroin consumers. So EMCDDA, we were organizing TIAFT, so we lost this information, but immediately the day after we received this, we phoned the police forces with the help of the Directorate of Drug Emergency, Dr. Cavallo. We phoned to Sardinia, and we discovered, firstly, that the fatalities were not 5, but were only 3. And then, with the help of the police forces, we asked the prosecutor to receive the autoptic biological fluids of the deceased. And finally, in September, this arrived. Well, in 1 out of 3 cases, xylazine was found in post-mortem samples. So here at the Institute, and with the help of Forensic Toxicology Laboratory in Verona, we could measure xylazine together with morphine in blood and urine. No fentanyl, no other drugs, only heroin and xylazine. 1 case. This was the first and the last. Then we didn't have any other opportunity to receive, nor us, nor any forensic toxicological laboratory to reanalyze other autoptic biological fluids containing xylazine. So we recorded only this episode. Nevertheless, in 1 month, we were able to put xylazine as a prohibited substance in the table 1 of the presidential decree 309. And these were the 2 grade 3 alerts launched after this situation. The first one was the communication of the fatality related to xylazine, and the second one was prepared by the Department of Anti-Drug Policies to inform all the hospitals or the forensic toxicology labs to have an eye opened to cases of heroin overdoses to see if xylazine was present too. With the spread of this news, we received pictures from an hospital nearby Naples of a poly abuser presenting these injuries in the limb. So immediately, the doctors collected urines because at the first time they thought, yes, this is xylazine coming into Naples. So we analyzed the urine samples in cooperation with the anti-poison laboratory of Pavia, and we discovered that it was not xylazine, but it was a mixture of many drugs, but the principal one was cocaine together with all metabolites and levamisole. The traditional cocaine adulterant, unless in Italy, the levamisole, which created a vasculitis following chronic and acute intake. And this was a polyabuser injecting heroin together with cocaine, adulterated with levamisole. So not xylazine, but we had the opportunity to discover another kind of adulteration. Fentanyl as an hot topic, let's go to benzimidazole. When in 2019, China banned the production of fentanyl derivatives in Europe and also in Italy, we observed the arrival in the illicit market, internet, dark web, street drugs of benzimidazoles, the nitazenes. You see here in black the nitazenes reported by EMCDDA, and in red the ones firstly detected in Italy: itazine, flunitazine, etonitazepipne, protonitazene, and let's see, and an increasing of these substances throughout the years. Let's talk about the fatality linked to etonitazepipne and the intoxication linked to protonitazene. Okay, the first 2 substances detected by the police forces were itazine and flunitazine. But then there was a story. In September 2022, the police forces found a dead body of a woman in a house, and they found a little plastic bag containing etonitazepipne. When we were informed by the police, we went by car to see the prosecutor in this region, in this city, and we begged for the autoptic biological fluids to analyze them. And in fact, inside the autoptic biological fluids of this deceased woman, we only found itonitazepipne in vitreous humor, gastric content, and in blood, in very low concentration, and no other substances. She was a former drug abuser in rehabilitation, which was proposed to try this new substance. She put the substance in mouth, little grains, and she died immediately. When we discovered this case, we asked the prosecutor to analyze the autoptic biological fluid of other cases in the same area. And we found other 2 fatalities of polyconsumers in which we found itonitazepipne. But as before, these 3 cases were the first and the last, because afterwards, maybe we no more had the opportunity to analyze other biological fluids from which were released by the prosecutors in charge of drug-related overdoses. In April 2023, the Anti-Poison Center in Pavia discovered a severe intoxication due to the presence of protonitazene together with cocaine, because the polyabuser declared he was sniffing cocaine, protonitazene up to 2 days before. What action did we put in place? Well, in 3 different years, we distributed 3 different sets of nitazene standards, and we organized other 2 proficiency testing. But as my colleagues at the Forensic Toxicology University said to me, these methanolic standards don't last forever. So we have to replace them, and we ask for some more money and to buy them, complicated legal permission to have them and redistribute to them. What I would like to say is that in Italy, collaborative centers and laboratories are well prepared to analyze these substances, and they are alerted to do this. But sometimes we don't receive so many biological fluids to be analyzed, because probably the organization, the workflows in the other part outside from our laboratories is not put in the right place for the moment. We also prepared some method of analysis. We had meta-analysis of fatalities and intoxication cases. We prepare this publication because we want to give our alert to our policymakers to say, hey, we are here, we discover all this, please do something. We released 10 documents on benzimidazoles identified in intoxication, death, adulterant, fake medicines in Europe and in Italy. But the real problem in Italy currently are not fentanyls or benzimidazole, are synthetic catechins, because as I told you before, they represent the 22% of reported new psychoactive substances in Italy. Specifically, since 2016, 33 synthetic catechins have been identified for the first time in Italy, alone or in combination with other substances, missold as MDMA. They are the keto analogs of MDMA, or used to adulterate MDMA. We have 3 deaths linked to synthetic catechins and 23 grade 1 alert. And our top synthetic catechins is MDPHP, alone or in combination. All the intoxication we registered, specifically in the north of Italy, mainly in the north of Italy, are linked to MDPHP. First problem. Second problem, synthetic cannabinoids. They represent the 14% of new psychoactive substances communicated to SNAP. From 2016, 20 synthetic cannabinoids detected for the first time in Italy, increasing each year. And the top one is esa-hydrocannabinol, the synthetic analog of delta-9 tetrahydrocannabinol, which can be synthesized in the so-called kitchen laboratories in Europe itself, in the east of Europe, in UK, and firstly reported in 2022 in Europe. Up to date, it has been identified by 23 member states plus Norway, where in herbal preparation, in fake hashish, in e-liquids for cigarettes, but also in candies. You know, during the Halloween time, my coworker Silvia Graziano discovered that in internet and in the darknet, there were many products, chips, candies, Halloween candies adulterated with esa-hydrocannabinol. And we have this top peak in 2023. Well, this is the Italian story. I could tell you all these particulars and these hot topics, this information, no thanks to me, but thanks to my team. Who we are? Well, it's me in the corner, but my right and left arm are Silvia Graziano and Maria Rosaria Vari. My responsible for communication from police forces and collaborative center is Anastasio. My responsible for the website platforms and technical problems every day at the telephone with all our users are Paolo and Michele. And I have 3 brand new, very young investigators devoted to the analysis of NPS and of known and unknown metabolites in conventional and non-conventional biological matrices. This is my SNAP team, but I have another team, which is the National Center for Addiction and Doping. My colleagues from more than 30 years with me, and, you know, especially my life sisters, Simonetta and Antonella. Thank you very much for your attention. Questions for me? These are Ciccio and Camilla.
Grant Baldwin, US CDC. More of a comment. One of the things I want to speak specifically about fentanyl adulterated with xylazine. And in the United States, when it was declared an emerging drug threat, we have the responsibility by the US government to develop that implementation plan. And part of that was clinicians were looking for resources when folks were showing up to emergency department and other healthcare settings. They didn't have good guidance on how to do clinical management of cases. And so if you go to US CDC xylazine, there's some materials that we put there collated from health departments across the US states and some academic centers that talk about what's best case scenario. 2 other things that this is more of a public service announcement. We are holding, the US government is holding a COCA call on February 29th about fentanyl adulterated with xylazine and its clinical management, which you can tune into if you would like. And then finally, and this does go to maybe the conversation we're having over the next few days, is we are also trying to figure out, in response to these kinds of things, setting up a learning collaborative of the community, both in terms of data collection, but also in terms of response, to sort of inform the field on some of these really novel substances that, there's not really good guidance yet on clinical management of how to do it better. So that's something we're trying to do in the US, working with other partners in other parts of the US government. So thanks for the great presentation, of course. And I love your dogs.
Yes, I want to mention that I think 1 month ago, the Department of Anti-Drug Policies organized a fentanyl emergency also in Italy. Even if you saw at the moment, currently, it seems that we don't have an alarm on fentanyl. Nevertheless, the Department of Anti-Drug Policies, the president of the Forensic Toxicology Group, the Ministry of Health, the hospitals, we are preparing an alert altogether. First, we were called to the Ministry of Health to organize and to verify the naloxone availability all over the country in the hospitals, and also the possibility to release spray naloxone, which is not so much used in Italy. We have only mainly the possibility of injectable naloxone. So the Ministry of Health is doing this spray preparation available all over the territory. I mean, we are implementing, we all together, Ministry of Health, the Institute, the Forensic Toxicology, we are creating, an important alarm to be prepared for this alert. As our DEA colleague said to me before, when the information arrives to the early warning system, it's too late. So I think that for the first time, we are trying to be in time for this possible eventuality.
Roman Serefo from the MCDA. Thank you, Simona. I think it was a great presentation. We are very, very proud of what you've done, working with us, of course. Maybe this is partly to answer the comment from our colleague from Indonesia in the morning, is if you have a good practice, which is well established, you can take it and implement it the way you want, as long as you keep the objectives and the definitions. What you've done is a system which is much more sophisticated than the European system, and it's normal because it serves a national reality, but the principles are the same. So I think what we are essentially discussing here today is, do we have a good example? Do we have a good practice? How do we implement it? We can implement the very basics, or we can implement it more and more sophisticated if we have the resources. And about information that is coming late to the early warning system or not, the most important thing of an early warning system is, of course, the early warning component, but also the memory. And our system is 25 years old, and we do have a memory about what has happened and how did we do things back in time. And taking the example of xylazine, which was a major story in the US, potential early warning system in the US would have captured it already in 2010 in Puerto Rico, where it was used extensively, and the effects, in particular the health effects, would have been well known. So the system, the overall system in the States, which is a huge one, it's a big country, it's not a simple environment, would have had some sort of an idea what are the potential health threats related to xylazine. So that's not to criticize it, it's just to emphasize the importance of, first, being early, and second, have the memory, being able to learn from the past and from the information that is being collected over time. Thank you once again for your great presentation.
Thank you, Roman. I wish to add that since in July 2024, the EUDA, the European, help me, will be devoted not only to new psychoactive substances, because we finally discovered that we have to come back to the classical substances of abuse. So the Department of Anti-Drug Policy decided to implement the SNAP system and the Italian early warning. And they created a strong cooperation with all the forensic toxicology laboratories in Italy. They created their own group, which I hope will join the global framework as universities, because they do a lot to be more specific in drug-related death than before. Well, they analyze drugs very well, but what we keep on repeating and repeating, we have to receive material to analyze. So we have to inform our, political counterparts, because I think that in Italy, unless the implementation is not on the labs but it's in the political and in the stakeholders, the civil society, join us more strictly to have more specific information. Sabina.
Thank you, Simona. Just to
Più
say-
forte, Sabina.
I don't, yes, does it work? Yes, Anti-Drug Policies Department is now building the database for future interpretation and future evaluation of what is going on. So as Forensic Toxicology Laboratories Network, we will collect data not only on drug-related deaths, that is a very important source of information, and first of all, from the polydrug use point of view, because generally it is not assessed, the polydrug use, but also we'll collect data on driving under the influence and road accident, data from intoxication when forensic toxicologists help clinical laboratories in intoxications, data from violences and drug-facilitated sexual assaults, and also as some of our laboratories also analyze Caesars, also information on Caesar. So it will be a widespread collection on information on the drugs that are circulating in our country. It is a preliminary work to go into a new EUDA commitment.
C'è Barry.
Thank you so much for your presentation. Barry Logan from CFSRE in the United States. One of the things I think that's important about the network that you've described is that you're getting samples to test from clinical intoxications as well as from postmortem, because you can argue that if you have to wait until somebody has died from a new drug, then it's not an early warning, it's a too late warning. So how does that work in your network in terms of coordinating awareness of the resources for testing amongst clinical medicine as well as forensic medicine?
Yes, this is a weak part of our network. In this sense, the north of Italy works very well because there is a very huge anti-poison laboratory which analyze all the intoxication, drug-related intoxication. The problem is that not all the other hospitals in the north of Italy, in the center, and imagine in the south of Italy are organized with the early warning analysis of these substances, especially because they don't have laboratories, facilities, and this is related to the economics of the hospital. Toxicological laboratories are not the most important task in the hospitals. So sometimes they do not dedicate a big budget for this problem, which is also the problem of drug under the influence of drugs. So what they do, they collect samples and they send the samples to huge laboratories, huge forensic toxicological or clinical laboratories, because they don't have resources in their area. What the Department of Anti-Drug Policies is now doing is trying to implement, but we cannot, reach everyone everywhere. We can reach with the standards of drugs. We can reach them with the information. We can stimulate the managers of the general hospital to implement the toxicological labs. If this is done, you remember, health is not private in Italy, it is public. This is a very good task for Italy. It is a very good research for Italy, but sometimes toxicological data, we have to push to explain why the analysis and why toxicological data are important. What we call the confirmation analysis, because the screening analysis are performed everywhere, but the screening analysis are cocaine, heroin, cannabinoids, amphetamines, and that's it. Now I have to say that the Ministry of Health for the first time asked for screening analysis of fentanyls and derivatives. So they are trying to implement also with kit reagents, because finally the end of the problem is to provide money to organize the laboratory. And it seems that now the mechanism started, hopefully. Roman.
Just it's actually to add to what Barry said, is we have actually, Paul didn't have enough time, but we have developed what we call a hospital emergency sentinel network. And it started from the field of MPS. Now it's been extended to, in the US, as they call it, the five, and NIDA 5, which is they focus more and more on these more classical drugs. But the whole idea about this sentinel network of hospital emergencies was actually, it started from the field of MPS. We run into the same problems. There is no samples. There is no need for clinical handling of cases to actually understand properly exactly what people have stayed. If they stayed like 5 hours in the department and left the hospital, you don't really need to know what they've taken, if they survive. But I think there was, and there is still this system that is operating in Europe. I don't know if it's a good practice. It's an expensive one. What we wanted to do many years ago when we established the MCDA, Paul is in the very origin of this, is we looked at what are the key epidemiological indicators, and hospital emergencies was considered as a key epidemiological indicator, and it was not adopted simply because it is very expensive and very laborious. Now we do it on a sentinel basis, and I think we do have some data that are also related to the MPS. Again, the main problem with the MPS field is that there's just too many different substances, and many of them wouldn't be actually able, in a clinical setting, to capture those. But we have the thinking about that. And the second thing, and I don't know if Michael's going to talk about it tomorrow, it's actually the use of poison centers, which is also extremely important in early warning. And it's linked to what we're discussing here, but maybe Michael will say something about it tomorrow. Sorry, thank you. It was a comment, it wasn't really a...
Thank you. We are not perfect, but we will try to be in a short time, no? Yes, Mike.
I'll have to remember to talk about poison centers now tomorrow. But thanks for a great presentation. Obviously, Italy has a very sophisticated early warning system with toxicology and analytical capability at its heart, which is everything you would want in an early warning system. But one of the things that really struck me when you showed the structure of your network was how multidisciplinary, multi-agency, multi-sectoral it was. And I wonder, having operated the UK early warning system many years ago, which is not even that size, how do you keep it all going? How do you keep everybody working together in Italy?
because we are tremendous people insisting and calling everybody. We use the Mediterranean style. We take the phone and we call everybody. There is Michele, my website assistant. He calls everyone every day. You have to join the early warning system. We have to join, and we work, and it's true. We work night and day. We work Saturday, Sunday, night and day, and it's true. Dr. Graziano, I think she sleeps 3 hours per night because we insist with people. We really believe in our job, and we call. You know, in the telenovelas, you see the Mediterranean people call and insist with everybody. Is what we do. But our cooperators are incredible, probably because this system started many years ago and was always implemented thanks to the anti-drug, the Italian Department of Anti-Drug Policies. We insist. Sì.
Hi, Simone. No, I have just a point to stress about the how to make the management of all this information. What, in my opinion, is still kind of a weak point of the system is the information about the persistence of these new compounds, new psychoactive compounds in the population. These alerts concern the finding of new compounds. But after the first finding, how is the half-life? How long is the half-life of these molecules? Very often they disappear, or they are not identified anymore. And it would be very important also that the collaborative centers all over the country are also informed of this, of the half-life of these molecules. And this, in my opinion, could be only possible by a deeper search in the biological materials. Otherwise, we could kind of overload the centers with information, and which, after the first alert, is not, is not updated.
Franco, very good comment. 2 answers. First, yes, we can overload the laboratories, but sometimes when we think we are forgetting one substance, it comes once again in fashion, like MDMA, no? We have to, today when I was speaking to Angela, I was saying, hey, NPS are a smallest part of drug abuse in Italy. We were speaking about NPS, but I have to remind you that 20 to 25% Italian population has used cannabis once in their life. Around 5% cocaine once in their lifetime. These are surveys. They are not proved by biological matrices, but these are surveys, online surveys. Heroin reaching 1% some years, but some others, they go down. And then there are the so-called psychonauts, drug seekers, who try new psychoactive substances. So this is still a little market compared to the one of new psychoactive substances. The problem is that it is a polyabuse. when you analyze the biological samples of an abuser, you find 10 or more substances, together with pharmaceuticals, benzodiazepines, antipsychotics, and so on. So it's true what you said, Franco, but sometimes some drugs like concentrated MDMA, more concentrated THC or THC in different forms. Oil, wax, now we have wax in fashion. THC, 80% THC wax in fashion, or cheese. Cheese is like in the form of cheddar cheese, THC at 80%. We should monitor our alert and our informative document since the beginning to see the persistence of a drug, of a cathinone, for example, in the national territory. But we need a volunteer to come and work with us. Come and work with us, because I think that my colleagues cannot have no more time to do this, but this is very interesting. Going back to the database and see how many times, for example, the police forces found MD, PHP, or mephedrone. Mephedrone seems to be almost disappeared because now MD, PHP is very much in fashion. So we have to work on it. You are right. Angela.
A comment or question, and then another question. One is to understand this versatility and resilience or non-resilience that MPS had on the market. And in a way, it's interesting that the beauty of having different skill specialization, I think there are the forensics that insist on the need of, to test, what to test more. From a social science perspective, I would be very interested to understand how these substances come and go and why. Is it, do they leave because there is no market? Do they leave because there has been control? Does really the control stop? What is the impact of the control at national level or international? Or the substance would have left the market anyway? Because the hundreds that we see, most of them, we see them once and then they don't come back. And so I would be interested to understand why. How does it work? Is a group someone that try and then see that it doesn't work, or they came by mistake, or I don't know if that is an analysis beyond the forensic analysis. But ultimately, I also have a question, to put this into a context of the meeting that we have here. So clearly, you have a fantastic system, seems to me, and works well also at a regional level. So even a country like Italy, what would be useful to have more on this international coalition? Or is there, what do you think, would be useful in this context in terms of sharing information or data, working together, even for a country like Italy?
Regarding the coming into market and coming away from the market of new psychoactive substances, I don't have an answer. So please help me to have an answer. I know from my Spanish colleagues, they told me once that the market of new psychoactive substances starts in Ibiza, in the Ibiza for the recreational drugs. I remember that at the end of the COVID, the first wave of the COVID, the cathinones disappeared, but now they are once more in fashion, other ones, but I don't have an answer. Regarding what can we do for the global coalition, I don't know. Show you our system, learn from you how to implement it, be available from the others, and work with you, because we are interested in. We can do inputs and outputs. Forse, aspetta Franco, c'era il...
Hi, I'm Jason Sandoval. I'm the DEA country attaché at the embassy here in Rome. And I've dealt with the opioid issue for 25 years of my career, going back to when we had the first wave of it in the mid 1990s, and it started in northern New Mexico and then spread around the country. And despite what a lot of messaging about law enforcement in the United States and what, that we target addicts and things like that, which nothing could be further from the truth. One lesson that I've learned in working across a variety of demographics in the US, from young people who are addicted to these substances and others, and from parents who've lost children and grandparents who've lost grandkids, is that there are three pillars of any detection system and any prevention system in any country. And those three pillars are indeed law enforcement, public health, and education. And the majority of lessons I learned in my last iteration of working this issue in the streets of South Carolina was that we failed, and I say we failed as governments, local, state, and federal, in terms of creating a sound counter-drug narrative for our young people to understand. I conducted some informal polls with kids in middle school and elementary school in the state of South Carolina, and I asked them if they could name me, how many drugs they could name me. As a DEA agent at the time with 20 years on the job, they could name drugs I hadn't even heard of, and these were 10 and 11-year-olds. My point of that is, as intelligent, highly trained medical, public health, law enforcement officials, we, in the United States at least, need to figure out our narrative against drugs, because we can put in all these epidemiological countermeasures, but unless we're convincing young people not to go to these substances that are glamorized constantly, every early warning detection system is going to just do exactly that, warn us about what's already here. I'm not sure this is exactly the right place to insert this into the dialogue, Simona, but I'm not certain I'll be here the whole week. So I just thought I'd throw that out there as a discussion point.
Okay, a short answer. Education. Education does not depend from the Institute of Health, but the Ministry of University and Instruction School. I don't know the English word for this. Education, thank you. Once, from time to time, we received some funds, and we, for example, we prepared an information course for all the teachers of the high school in Italy, because in the National Institute of Health, we have an online platform called EDWIS, in which there are online courses for everything, COVID, bacteria, health, waters, soils, food. When we receive funds, we organize these platforms to inform, for example, on alcohol, fetal alcohol syndrome. We prepared 35,000 professionals on fetal alcohol syndrome, which was unknown some years ago in Italy. We have to receive funds. This was the first task our new president communicated to us when he arrived 2 months ago. Education of good lifestyles. Education in the school, primary school, secondary school, at the stadiums, at the sports sites. Yes, we have this in mind. We have to find money. It's a question of money sometimes. It's only a poor question of money.
Very short. I think Inshik Shim from UNODC Bangkok office. My question is might be related to the one just the colleague mentioned. At the end of the day, I think this early warning system is to prevent the harms in society of this drug being circulated. In that sense, what's the mechanisms to engage with the general public for this information generated from this early warning system?
Okay. The information of general public does not depend from early warning system On the contrary, we are a closed system. We discussed it many times in Europe with EMCDDA if we should spread the information we have on new psychoactive substance to the general population. Finally, the Italian governments decided not to do this, but to inform only the most possible number of health professionals and also all the ones related to drug consumers. So we try to do a domino effects. We pass the information to the regions, to the local authorities, to the therapeutic center, to the detoxification center, and then they have the tools and the ability to talk to the consumer. This is an open problem we never solved because I know that in some member states of Europe, the alerts are public. But the Italian government decided not to inform the general society on this. Probably now with the fentanyl alarm, we will do it also because there are news on the newspapers, news on internet. But we are trying to do a domino effect. We are in charge of informing health professionals and policy stakeholders and police forces. And then they inform in the way they think to do this. Matteo.
Matteo Marti, I'm a head of Forensic Toxicology Laboratory in Ferrara University, and I'm working on preclinical research. So I want just to spend a few words about that because I think that the preclinical research for translational studies is not so well evaluated now at this point because I'm worried about the emergency room where we saw people intoxicated and physician help us how we can treat these people, how we can resolve in acute intoxication, but not only acute intoxication because we know that some synthetic cannabinoids, other NPS, can induce, after repeated administration, mental disease, psychosis that are growing in Italy. Is very important, this problem. So I think an important aspect that we have to stress, or we more consider, is the evidence-based from research, preclinical research, but in the optical to translate this information to a clinician, because it's not just, sorry for my English, a joke for the researcher in the lab with mouse or other stuff. But I think that the translational research can help the early warning system, can help the emergency room, can help our technique in forensic medicine, because we study new metabolites from animal, from in vitro or in vivo stuff, to find these molecules then in patient, in in fluids of dead people. So Simona, can you give us a comment? Because you know that in Italy we are, we do this kind of research in collaboration with the DPA, also with the early warning system. So, and is a good model to expand to, okay?
Yes, Matteo, it's true. The Italian Department of Anti-Drug Policies not only support the early warning system, but they also support a group of not only forensic toxicologists, but a group of investigators which are, parallel to the early warning system, investigating on new psychoactive substances. The name is very long, it's the multi-center investigation on new psychoactive substances. I mean, there are some forensic toxicological labs, the anti-doping lab in Italy, some important universities, toxicological forensic laboratories in charge with new psychoactive substances investigation, who form a group of investigators. I think you are 5 groups or 6 groups, maybe.
Yeah, 5, 6.
And they are only devoted to preclinical, analytical studies, metabolomics, metabolites of new psychoactive substances in animal models, in hepatocytes, in vitro models. And they implement this investigation with publication. We do a lot of spread of this publication that this group perform in
sure.
Italy.
Because we are convinced that if we are able to investigate for synthetic cannabinoids, there are a lot of compounds. So it's not possible to investigate all synthetic cannabinoids, all the effects. But if you are able to identify the major side effects, acute side effects, so in the hospital, when the physician do analysis and say, okay, this is probably a synthetic cannabinoid, it's not important if it's an indazole or AKB48 or IB, I don't know, but it's a synthetic cannabinoid. So we know that in case of, I don't know, arrhythmia, we do not have to treat the patient with, I can say, some drugs. Or for psychotic patients, you have not to use haloperidol because you increase the QT. So this is the importance of preclinical research. In fact, in the last time, the police find a new compound, a seizure, new compound in Italy, and the control poison center of Pavia find 1 case of intoxication. I have the molecules, and in fact, I can find the real effect of the drug because in intoxicated patient, they found not only this tryptamine, particular tryptamine, but they find also ketamine, THC. So in this case, we can immediately say, okay, the drug that induced this kind of intoxication is that. And this is a collaboration between law enforcement, the DCSA with Marco Cavallo and the staff, with toxicology from Anti-Poison Center, with forensic toxicology, because from this animal, we gave the samples and Sabina Strano-Rossi and other look at the metabolites immediately. So in 1 month, we can have a picture, a complete picture, a clear picture. So I think this is very important also to share with the other lab in Europe, in United States, with other NIDA or so. You know, Michael Baumann, I think in NIDA is a great scientist with I collaborate with him. So this is the point because I stress the preclinical research. Okay, thank you.
No more questions? Thank you, Roman. So it's time to say bye-bye. Brian, I don't know if you wish to say some other words. Remember that tomorrow, don't come here. Go to Via Castro Laurenziano number 10, Beauvais meeting room. Please, Brian. Marotta. Marotta. Another Nobel Prize. Marotta. But you will see us, so no problem. If you arrive there, we will be there.
Thank you, Simone. I don't want to take too much time so people can get out a bit and see Rome and while there's still daylight. But I do want to thank everybody for, wow, such a great session today. I think we really, I've taken a lot of notes today. I think we've really done a really good job in terms of zooming out and getting the global landscape picture, looking at regional models, looking at the national model, understanding the different levels of where we need to go. And already, I know Sarah's been taking a lot of diligent notes. There's a lot of sort of ideas and recommendations that are coming out, even if we're not saying, I recommend this, we're hearing it, just some things that stuck in my mind, and I want to go just backwards. The preclinical research, the translation, preclinical research for translational application, that I think is very important. We're also working with a lab in Mexico, Cinestab, to look at the combination of adulterants that in their independent state may not precipitate an overdose, but in combination in rat studies they are. And so seeing, you know, the strange kind of effects that these chemicals can have on each other, I think is fascinating, complex, and not enough is being done around the world on this one. The use of poison centers in early warning, I think very important, fascinating. The use of artificial intelligence really stuck out at me when in the discussion of drug market surveillance, regulatory, engagement of civil society as well with people who use drugs who are so close to the issue, and then sort of finding that network. We've heard that also from many civil society groups. We're in contact with people. I visited Villa Maraini this weekend, and I saw sort of a lot of the work that they're doing in the field with, to reduce harms, but also it's the engagement opportunity for treatment and to do the motivational and to try to sort of meet people where they are, and they have a sense, a pulse of what's happening in a way that that is very valuable in terms of understanding the complexity, the dynamics of the local situation. I think that there's some policy recommendations in there as well when we talk about ethical sort of considerations in data sharing and building trust. There's some principles, there's some actions that governments could take in terms of adoptions of policies around that as well that we should look at. Fascinating about new technologies, although I think that in sort of undertaking something so vast as these Global Coalition meetings, to launch a brand new idea and a big initiative is always very risky because we have so many already in the pipeline that we just need to expand usage of. And so I always also enter new things with a bit of trepidation as, yes, we can kind of put it on the list, but do we want to completely sink into something now? But if there are new technologies that we can look at, and I think one of those that we've discussed is from the public health side, this tool that South Africa has innovated on the Assist, this clinical screening tool, which is now digitized and can provide heat maps and kind of color the situation of different indicators. I think things like this might be useful. And I was very receptive also, as you were saying, Angela, from the public health side. How do you take the local to the international? Well, this is one of those examples of these tools where it's something clinicians can use, and you can produce kind of these GIS maps that now you can kind of see what the local situation is and keep zooming out and see across different indicators what that looks like. So those are just some initial observations from me today. Tomorrow, I think we're going to look at very specific, broad issues specifically. That's an oxymoron. But I think that the goal with this will be to really get more into recommendations from you all. And we kind of didn't do the exercise today, which part of me said, it was good not to go back to it. But one of the things that we had originally with introductions, a brief introduction of your area of work, and what drug-related data do you have access to and collect? It was as an icebreaker. We didn't need the icebreaker, but I think that if you do look at the participant list, the vastness of topics that all of the co-chairs cover is really fascinating to me, and it shows that data is found everywhere, and that is our inherent problem as well, because there are too many little things to grab onto to build the big picture. When I was a child, I used to love Lego bricks. I still like Lego bricks, but I think that is sort of the exercise. Blank slate, imagine a middle or low income country, and you have all these bricks. How do you start building that system? And you can take models from Italy that has the Cadillac version, let's say, but what do you prioritize? And if you had to build, in a sequenced way, how do you build that architecture? So I hope we get a little bit more in that direction, because the goal of the coalition is to offer something for everyone, so that they can build their own kind of structure, but guided by what's accessible and out there for everybody. So with that all, I think it's a good time to pause, and looking forward to the discussions tomorrow, and then all of your ideas and recommendations as well. I will finally say, if you all have not joined the working groups or sub-working groups of the Global Coalition, I'm going to just leave up here the QR codes. You can choose one of 6 languages and register, because the meetings are coming up next week and the week after. So we'd love to have you join our mailing list, and then we will send you the calendar invites for those meetings. Thank you all so much. And thanks for those online as well for your endurance at crazy hours, including our interpreters as well in Uzbekistan. I see my friend Dimitri there. Thank you all so much, and have a good afternoon, and enjoy Rome. Thank you.